Detecting and treatment of silent reflux. Now you can easily and quickly relieve severe coughs and heartburn. Valentin. Basic information. Silent reflux. Silent reflux, also known as laryngopharyngeal reflux, LPR, is a form of reflux in which stomach acid and digestive enzymes rise into the esophagus and down into the throat and airways without causing the typical symptoms of heartburn. Unlike classic acid reflux, which is usually characterized by a burning sensation in the chest or upper abdomen, silent reflux often causes no obvious signs in the digestive tract. Instead, symptoms occur in the throat and airways, such as a chronic cough, hoarseness, sore throat, or a feeling of a lump in the throat. Silent reflux can be particularly insidious because it often goes unnoticed for a long time. Because the symptoms are more subtle and often difficult to identify, the condition is often not directly associated with the digestive system. Patients frequently suffer from coughs, voice problems, or recurring sore throats and are often unaware that these are related to reflux. Another problem is that, unlike classic reflux, silent reflux often occurs without clear pain or obvious heartburn, making diagnosis difficult. The differences between silent reflux and classic reflux. The main difference between silent reflux, LPR, and classic reflux, gastroesophageal reflux, GERD, lies in the symptoms and the areas affected. Symptoms. Classic reflux, GERD. Typical symptoms include heartburn, a burning sensation behind the breastbone, a sour taste in the mouth, stomach acid regurgitation, bloating, and stomach pain. Symptoms are often most severe after eating or while lying down and primarily affect the esophagus and stomach. Silent reflux, LPR. This condition often lacks classic symptoms such as heartburn. Instead, it causes discomfort in the throat, larynx, and respiratory tract. Common symptoms include chronic cough, hoarseness, a need to clear the throat, a lump in the throat, chronic sore throat, and difficulty breathing. In severe cases, inflammation of the vocal cords or difficulty swallowing may also occur. Symptoms often occur regardless of food intake and can worsen during sleep. Affected areas. GERD. In classic reflux, the reflux is usually limited to the esophagus, which causes the typical heartburn symptoms. LPR. In silent reflux, stomach acid rises higher, reaching the larynx, throat, and sometimes even the respiratory tract. This can irritate the mucous membranes in the throat area, leading to the symptoms described above. Sometimes, stomach acid even enters the sinuses or lungs, which can cause further symptoms such as sinusitis or breathing problems. Pain sensation. GERD. Heartburn and pain in the esophagus are typical symptoms that can often be easily localized. LPR. Silent reflux often doesn't cause direct pain in the stomach or chest area. Instead, symptoms such as pressure or irritation in the throat, chronic cough, or difficulty breathing are the main symptoms. Diagnosis. GERD. Classic reflux is often diagnosed through endoscopy, pH measurements, or typical symptoms such as heartburn. LPR. Diagnosis of silent reflux often requires specialized testing because the symptoms are less clear. A laryngoscopy, examination of the larynx, or a pH test in the throat may be necessary to determine reflux in the upper airways. Silent reflux often goes undetected for a long time because the typical symptoms are missing and it is more commonly perceived as a respiratory or vocal problem. This often leads to sufferers receiving incorrect treatment for a long time before the actual cause is identified. However, early diagnosis and targeted dietary changes can be crucial to alleviating symptoms and preventing long-term damage. Identify and avoid causes and risk factors for silent reflux. Silent reflux, also known as laryngopharyngeal reflux, LPR, occurs when the lower or upper esophageal sphincter malfunctions. These muscles normally prevent stomach contents from rising into the esophagus. However, in silent reflux, these sphincters malfunction, causing stomach acid, digestive enzymes, and sometimes even food particles to flow back up into the throat and airway. Common causes: weakness of the lower or upper esophageal sphincter, the lower esophageal muscle LER, and the upper esophageal muscle UES, regulate the flow of food and stomach acid. If either of these muscles weakens or malfunctions, acid can rise from the stomach into the esophagus. In silent reflux, stomach acid can reach the throat and airway. Stomach overload, overloading the stomach, for example, through large meals or frequent eating, increases pressure in the stomach. This pressure can cause the lower esophageal muscle to open, promoting stomach acid reflux. Hiatal hernia, diaphragmatic hernia. This anatomical abnormality occurs when part of the stomach protrudes through the diaphragm into the chest. This can increase pressure on the lower esophageal sphincter and lead to reflux. Obesity. Obesity increases pressure in the abdominal area, which can impair the esophageal sphincter and thus increase the risk of silent reflux. Pregnancy. During pregnancy, the stomach is compressed by the growing baby, which also increases pressure in the abdominal cavity and can weaken the sphincter. Stress and tension. Chronic stress can negatively impact the digestive tract and increase acidity in the stomach. Stress can also lead to unhealthy eating habits or overconsumption of foods that promote reflux. Medications. Certain medications such as calcium channel blockers, painkillers, or antidepressants can increase pressure in the stomach or weaken the lower esophageal sphincter. Poor eating habits. Eating large meals, especially in the evening, or eating in a hurry can contribute to reflux. Furthermore, acidic, fatty, and highly processed foods often led to an overproduction of stomach acid. How silent reflux symptoms are related to diet. Diet plays a crucial role in the development and aggravation of silent reflux. Certain foods and eating habits can increase stomach acid production, increase pressure in the stomach, or weaken the esophageal sphincter. In contrast, a healthy, balanced diet and avoiding acid-forming foods can alleviate symptoms and lead to long-term improvement. Foods that worsen silent reflux. Acidic foods. Citrus fruits, such as oranges, lemons, tomatoes and tomato-based products. Ketchup, tomato sauce, increase acid production in the stomach and can irritate the mucous membranes in the throat and larynx. Fatty and fried foods. Fat slows gastric emptying and increases pressure in the stomach, which can worsen reflux. These include foods like French fries, fast food, and fried foods. Caffeinated drinks. Coffee, black tea and cola contain caffeine, which can weaken the lower esophageal muscle and thus promote the reflux of stomach acid. Alcohol. Alcohol relaxes the lower esophageal muscle and increases stomach acid production. Wine and beer, which have high acid content, are particularly harmful. Hot spices. Foods high in spices such as chili or pepper can irritate the mucous membranes and worsen symptoms such as sore throat, hoarseness and cough. Chocolate. Chocolate contains theobromine, which weakens the lower esophageal muscle and thus promotes the reflux of stomach acid. Onions and garlic. These foods can irritate the stomach and increase acid production, which can lead to increased reflux symptoms in sensitive people. Dietary changes that help. Low acid diet. Avoiding highly acidic foods such as citrus fruits, tomatoes and coffee can reduce the acid load in the stomach and thus reduce reflux. Low-fat diet. A low-fat diet reduces pressure on the stomach and promotes faster digestion. Recommended foods include lean meat, fish, poultry, whole grains, and vegetables. Eat more fiber-rich foods. Fiber improves digestion and aids gastric emptying. These include fruits, excluding citrus fruits, vegetables, oatmeal, and whole grains. Small, frequent meals. Instead of eating 3 large meals, eat smaller, more frequent meals. This prevents stomach overload and reduces pressure on the sphincter. Water-rich foods. Cucumbers, zucchini, melons and other water-rich foods help soothe mucous membranes and aid digestion. Avoid eating close to bedtime. Late meals or snacks close to bedtime promote reflux. It is recommended to avoid eating at least 2-3 hours before bedtime. Herbal teas. Certain herbal teas such as chamomile or ginger tea can aid digestion and have a soothing effect on the stomach. A targeted dietary change can play a crucial role in controlling the symptoms of silent reflux. By avoiding trigger foods and incorporating foods that are gentle on the stomach, the risk of reflux and the associated symptoms such as coughing, hoarseness, and sore throat can be significantly reduced. Chapter 1. The Invisible Disease. Understanding silent reflux. The most common symptoms: cough, sore throat, lung pain. Silent reflux, laryngopharyngeal reflux, LPR, often presents with a variety of symptoms that are not always obviously associated with the digestive tract. Unlike classic reflux, the symptoms do not occur in the stomach or chest area, but primarily affect the throat, airways, and lungs. The most common symptoms include chronic cough. A persistent, dry cough is one of the most common signs of silent reflux. This cough often occurs without an obvious cause, such as a cold or respiratory illness. It can become particularly intense at night or early in the morning, as rising stomach acid can freely enter the throat and airways while sleeping. The cough is caused by irritation of the mucous membranes in the throat and larynx caused by stomach acid. Sore throat. A sore throat that recurs repeatedly or is chronic is another common symptom. Unlike infectious causes, such as a cold, this type of sore throat often persists for an extended period without any detectable infection. Silent reflux causes inflammation of the mucous membranes in the throat, as the rising acid irritates the sensitive tissues. This inflammation can cause both pain and an unpleasant scratchy or burning sensation in the throat, lung pain and breathing problems. In some cases, silent reflux can reach the airways or even the lungs. This can lead to breathing difficulties, wheezing, or even lung pain. Those affected often describe a feeling of pressure or tightness in the chest, similar to asthma. It can even lead to recurring bouts of bronchitis or pneumonia, as stomach acid damages the mucous membranes in the airways and triggers inflammatory reactions. These symptoms are particularly aggravated at night or when lying down, which can disrupt sleep. Other common symptoms: hoarseness or voice problems. Stomach acid can irritate the vocal cords, resulting in a hoarse, cracked, or deep voice. Lump in the throat. Many sufferers describe the feeling of having a lump in their throat that makes swallowing difficult. Compulsive coughing. Frequent, often unconscious coughing is a typical sign of silent reflux, as it is an attempt to remove irritants from the throat. Difficulty swallowing. Inflammation and swelling in the throat can make swallowing difficult and painful. Sour taste in the mouth. Although heartburn is not always present, some sufferers report a bitter or sour taste in the mouth, especially in the morning. How silent reflux is often misdiagnosed. Silent reflux is often overlooked or misdiagnosed because the symptoms do not match the typical signs of gastroesophageal reflux, GERD. Because there is no obvious stomach or chest pain, many patients and doctors initially suspect other causes. This often leads to sufferers suffering from symptoms for an extended period before a correct diagnosis is made. The following factors contribute to misdiagnosis. Confusion with respiratory diseases. Because silent reflux frequently leads to chronic coughing, sore throat, and difficulty breathing, it is often confused with asthma, bronchitis, or other respiratory diseases. Patients complaining of shortness of breath, wheezing, or lung pain are often initially diagnosed with asthma or chronic bronchitis. In many cases, they are even treated with inhalers or bronchodilator medications, which, however, do not improve symptoms, ear, nose and throat problems, and, since silent reflux symptoms such as hoarseness, constant throat clearing, or a lump in the throat are more likely to indicate ear, nose, and throat problems, many sufferers first consult an ENT doctor. They often receive a diagnosis such as chronic laryngitis, vocal cord problems, or an upper respiratory tract infection. Reflux disease is not always considered because the symptoms do not immediately point to the digestive tract. Standard treatments with antibiotics or anti-inflammatory medications are often ineffective because the underlying cause remains untreated. Confusion with allergies. Many symptoms of silent reflux, such as a persistent cough, sore throat, and hoarseness, can also indicate allergies. Often, sufferers are told they are allergic to pollen, dust, or other environmental factors, leading to erroneous treatment with antihistamines or steroids. In reality, however, these medications are usually ineffective because the root cause of the problem is the rising gastric juices. Psychosomatic misdiagnoses. Because the symptoms of silent reflux are diffuse and difficult to classify, they are sometimes dismissed as psychosomatic. Those affected may then be diagnosed with an anxiety disorder or depression, as silent reflux can lead to a significant impairment of well-being. The true physical cause is often not recognized. Lack of awareness of silent reflux. Many people, including doctors, are not sufficiently aware of silent reflux and its symptoms. The lack of classic heartburn means that the connection between the symptoms and the digestive tract is not immediately established. This often leads to delayed diagnosis and treatment. Inadequate diagnostic methods. Diagnosing silent reflux requires specialized tests such as laryngoscopy or pharyngeal pH testing to determine the reflux of stomach acid into the upper respiratory tract. Because these tests aren't routinely performed without typical reflux symptoms such as heartburn, silent reflux can easily be overlooked. Summary. Silent reflux is often characterized by symptoms such as chronic cough, sore throat, and lung pain, which often indicate respiratory or end problems. These non-specific symptoms often led to misdiagnosis and delayed treatment. A better awareness of the possible symptoms and targeted diagnostics are crucial for initiating appropriate treatment and preventing long-term problems. How silent reflux can cause long-term damage. Silent reflux, laryngopharyngeal reflux, LPR, often goes unnoticed because typical symptoms like heartburn are absent. However, if left untreated for a long period of time, it can lead to serious health problems. The rising stomach acid and digestive enzymes not only irritate the mucous membranes in the throat and airways, but also cause inflammation and tissue damage. Here are some of the possible long-term effects. Damage to the vocal cords. Chronic irritation of the vocal cords by rising acid can lead to permanent voice problems. This manifests as hoarseness, a harsh voice, or even a complete loss of vocal cord vibrations. In more severe cases, vocal cord nodules or polyps may form, requiring surgical treatment. Inflammation of the esophagus, esophagitis. Stomach acid that travels up into the esophagus and throat can cause esophageal inflammation, even if heartburn isn't noticeable. This chronic inflammation can lead to ulcers, scarring, and narrowing of the esophagus, strictures, making swallowing difficult. Barrett's esophagus. Another possible long-term consequence of silent reflux is Barrett's esophagus. In this condition, the tissue in the lower esophagus changes due to damage from chronic exposure to stomach acid. Barrett's esophagus significantly increases the risk of developing esophageal cancer. Chronic inflammation of the throat, pharyngitis. Repeated exposure to stomach acid in the throat leads to chronic inflammation, pharyngitis. This can cause persistent sore throat, difficulty swallowing, and persistent irritation. Without treatment, this inflammation can worsen and damage other areas of the throat and airways. Swallowing disorders, dysphagia. Persistent irritation of the mucous membranes in the throat and esophagus can lead to scarring and narrowing, causing swallowing difficulties. This dysphagia can significantly impact daily life and increase the risk of aspiration, food or liquid entering the trachea. Tooth damage. Rising stomach acid can also damage teeth. When the acid reaches the mouth, it attacks tooth enamel, leading to weakening and erosion. This increases the risk of tooth decay, gum disease, and tooth sensitivity. Increased risk of respiratory diseases. Continuous irritation of the airways by stomach acid can lead to deterioration of lung function and a variety of respiratory diseases, as described in detail in the next section. The connection between silent reflux and respiratory diseases. Silent reflux can not only affect the throat and esophagus, but can also travel up into the airways, causing long-term damage. When stomach acid and digestive enzymes reach the trachea, bronchi, or lungs, they cause irritation and inflammation of the airways. This leads to a variety of respiratory conditions that are often not immediately associated with silent reflux. Asthma and asthma-like symptoms. There is a well-documented link between silent reflux and asthma. The reflux of stomach acid into the airways can trigger or worsen asthma attacks, especially in patients who already suffer from asthma. The acid irritates the mucous membranes of the airways and causes constriction of the bronchi, which can lead to symptoms such as wheezing, shortness of breath, and coughing. In some cases, chronic reflux causes patients who previously did not have asthma to develop an asthma-like condition. Chronic bronchitis. Repeated exposure to stomach acid in the bronchi can lead to chronic inflammation of the airways. This often manifests as chronic bronchitis, characterized by a persistent cough and mucus production. This inflammation of the bronchi can lead to recurrent infections and impair lung function over time. Pneumonia. In some cases, rising stomach acid can enter the lungs and cause a chemical pneumonia called aspiration pneumonia. This form of pneumonia occurs when stomach acid and digestive enzymes attack the alveoli, causing inflammation. Aspiration pneumonia can be serious and require intensive medical treatment. Chronic obstructive lung disease, COPD. There is evidence that silent reflux can worsen symptoms in people with chronic obstructive pulmonary disease, COPD. Acid in the airways promotes inflammation and leads to a deterioration in lung function. COPD patients who also suffer from silent reflux often have more frequent exacerbations, acute worsenings, and more severe symptoms than those without reflux problems. Laryngitis and vocal cord problems. Silent reflux can lead to chronic inflammation of the larynx. Laryngitis. This inflammation can not only cause hoarseness and voice problems, but also impede breathing, especially if the vocal cords are severely affected. In severe cases, shortness of breath can occur because the swelling of the larynx narrows the airways. Sleep apnea. There is also evidence of a link between silent reflux and sleep apnea, a condition in which breathing pauses repeatedly during sleep. Reflux can irritate the airways during sleep, causing narrowing or blockage, which can worsen the symptoms of sleep apnea. Postnasal drip. Silent reflux can also cause excessive mucus production in the sinuses and throat. Known as postnasal drip, this mucus runs down the throat and leads to a persistent cough, nasal congestion, and constant throat clearing. Postnasal drip is often confused with allergic reactions or infections, but in reality it can be triggered by reflux. Summary. If left untreated, chronic silent reflux can cause long-term damage to various parts of the body, including the vocal cords, esophagus, teeth, and especially the airways. Rising stomach acid irritates and inflames the airways, which can lead to respiratory illnesses such as asthma, bronchitis, and pneumonia. Early diagnosis and targeted treatment are crucial to prevent such complications. Chapter 2. Diagnosis of silent reflux. The path to the correct diagnosis. Doctors, tests and examinations. Since silent reflux, laryngopharyngeal reflux, LPR, is often difficult to diagnose because the symptoms are not typical of classic reflux, a proper diagnosis requires a careful examination and collaboration with specialists. Here are the steps patients can take on the path to a diagnosis of silent reflux. Family doctor or general practitioner. The first step in seeking a diagnosis is usually a visit to your primary care physician. Because the symptoms of silent reflux, such as coughing, hoarseness, or sore throat, are nonspecific, your primary care physician may initially suspect another condition, such as a cold, allergies, or a respiratory illness. However, if symptoms persist or do not respond to standard treatments, your doctor may raise the possibility of silent reflux and refer you to a specialist. End doctor, ear, nose and throat doctor. Because silent reflux symptoms often affect the throat, voice, and airways, the next step is to see an ENT doctor. The ent doctor will examine the larynx and vocal cords to detect signs of inflammation or damage caused by reflux. A commonly used procedure is laryngoscopy, which uses a thin, flexible instrument with a camera to examine the throat and larynx. This can detect redness, swelling, or other signs of reflux damage. Gastroenterologist, gastrointestinal specialist. If the ent doctor confirms the suspicion of silent reflux, a gastroenterologist is often consulted to determine the exact cause and extent of the reflux. A gastroenterologist specializes in diseases of the digestive system and can perform specific tests to confirm the diagnosis. Common tests include 24-hour pH measurement. This test involves inserting a thin probe into the esophagus to measure acid levels over a 24-hour period. This test accurately records the frequency and severity of acid reflux. This test is particularly useful for determining the level of reflux and whether it is reaching the throat. Manometry. This test measures the pressure and function of the lower and upper esophageal sphincters, the muscles that close the esophagus. Reduced function of these muscles may indicate silent reflux. Esophagogastroduodenoscopy. Endoscopy. This involves inserting a flexible tube with a camera into the esophagus and stomach to detect tissue damage, inflammation, or other signs of reflux. Endoscopy is often performed when complications such as esophagitis or Barrett's esophagus are suspected. Pulmonologist, lung doctor. If silent reflux symptoms affect the airways and lungs, such as chronic cough or difficulty breathing, a pulmonologist may be consulted. The pulmonologist will perform breathing tests such as spirometry, pulmonary function testing, to determine if reflux is affecting the airways. Occasionally, a bronchoscopy is also performed to examine the lungs and airways for signs of reflux damage. Diagnosis by exclusion. Because many symptoms of silent reflux resemble other conditions, diagnosis can be made by exclusion. Your doctor will rule out other causes such as asthma, infections, allergies, or vocal cord disorders before diagnosing silent reflux. Important questions you should ask your doctor. If you suspect you may be suffering from silent reflux, it's important to be well prepared for your doctor's appointment and ask the right questions. These will help you better understand the condition and ensure you receive the right treatment. Questions about diagnosis. How is silent reflux diagnosed? Ask your doctor about available diagnostic tests, such as pH metry or endoscopy, to determine if your symptoms are caused by reflux. Could my symptoms be caused by another condition? Since silent reflux symptoms can also occur in other diseases, it is important to understand what other diagnoses may be involved and how they can be ruled out. Is a referral to a specialist necessary? Ask if a referral to an ent doctor, gastroenterologist, or pulmonologist is necessary to further evaluate your symptoms. Which tests are best for me? Your doctor may suggest a variety of tests. It's important to understand which test will provide the most information in your specific case. Questions about treatment. What dietary changes do you recommend for silent reflux? Since diet plays a key role in relieving reflux symptoms, you should ask for specific dietary recommendations to help reduce your symptoms. Do I need medication? And if so, which ones? Find out about the advantages and disadvantages of medications such as proton pump inhibitors, PPIs, or H2 blockers and how long they should be taken. Are there other lifestyle changes besides diet that can help? Your doctor may recommend other measures, such as avoiding late meals, elevating your head in bed, or reducing stress. What are the risks of taking reflux medication long-term? Long-term use of medications such as proton pump inhibitors can carry risks. Ask if long-term medication is necessary and whether alternatives are available. Questions about prognosis and long-term consequences. How long does it take for symptoms to subside after treatment? Understand how quickly you can expect improvement in symptoms and what measures are needed for long-term control. What are the possible long-term consequences if silent reflux is left untreated? It is important to understand the risk of long-term complications such as esophagitis, vocal cord problems, or even esophageal cancer. How can I prevent relapses once my symptoms subside? Ask about preventative measures to prevent silent reflux from returning. Summary. The path to a proper diagnosis of silent reflux often involves multiple steps, including seeing different doctors and specialists and undergoing specific tests. It's important to be proactive and ask your doctor specific questions about diagnosis, treatment, and prevention to ensure you receive the right treatment and can avoid long-term damage. How the right diagnosis can change lives. A correct diagnosis of silent reflux, LPR, can significantly change the lives of those affected, as they often suffer for years from diffuse symptoms that are difficult to classify. These symptoms, such as a chronic cough, sore throat, hoarseness, difficulty breathing, and a feeling of a lump in the throat, impair quality of life and often lead to misdiagnosis. However, once the exact cause is identified and targeted treatment is initiated, many patients experience a significant improvement in their well-being and quality of life. Here are some of the key positive effects that a correct diagnosis of silent reflux can have. Eliminating years of uncertainty. Many patients suffering from silent reflux often have a long odyssey of doctor visits behind them. The symptoms can indicate various conditions, such as asthma, allergies, or chronic bronchitis, which often leads to incorrect diagnosis. The uncertainty about the cause of the symptoms can be very stressful. A clear diagnosis finally gives those affected certainty and puts an end to the often frustrating guesswork. Targeted and effective treatment. Once a clear diagnosis has been made, targeted measures can be initiated to treat silent reflux. This usually includes dietary changes. Avoiding acid-forming and high-fat foods can provide quick and noticeable relief from symptoms. Lifestyle changes. Measures such as elevating the head while sleeping, eating smaller meals, and avoiding meals before bedtime help control symptoms. Drug treatment, if necessary. Medications such as proton pump inhibitors, PPIs, or H2 blockers can help reduce acid production in the stomach and protect the mucous membranes. These measures can often significantly reduce or even completely eliminate reflux symptoms. This leads to a noticeable improvement in quality of life and a significant reduction in symptoms such as coughing, sore throat, or breathing difficulties. Improved quality of life and well-being. Once the symptoms of silent reflux are alleviated or controlled, patients can experience a significant improvement in their overall well-being. Symptoms such as sleep disturbances caused by nighttime coughing or sore throats that interfere with daily communication often disappear. This leads to more energy and a sense of joy in everyday life. fewer misdiagnoses and unnecessary treatments. An incorrect diagnosis can often lead to patients receiving unnecessary or even harmful treatments over a long period of time. For example, sufferers with chronic cough or breathing difficulties are often treated with asthma medications, inhalers, or antihistamines, which do not provide relief if the true cause is silent reflux. With a correct diagnosis, these unnecessary treatments can be avoided, and therapy can be targeted to the actual cause. Prevention of long-term complications. Early diagnosis of silent reflux can help prevent serious long-term complications. Untreated silent reflux can lead to chronic esophagitis, Barrett's esophagus, a precursor to esophageal cancer, lung problems, or permanent voice problems. With proper diagnosis and targeted treatment, these complications can be avoided. Voice restoration and relief from voice problems. Many people suffering from silent reflux experience persistent voice problems, such as hoarseness or a rough, cracked voice. This can be particularly distressing for those affected who work in professions where the voice plays a central role, such as teachers, singers, or people in communication professions. Proper diagnosis and treatment of silent reflux can protect the vocal cords and restore the voice, providing tremendous relief and improving quality of life for those affected. Reduction of breathing difficulties. Patients suffering from breathing problems caused by silent reflux, such as wheezing, shortness of breath, or a persistent tickly cough, can experience significant improvements in their lung function after diagnosis. Targeting the reflux reduces airway irritation, leading to easier breathing and a reduction in asthma-like symptoms. Psychological relief. Chronic health problems like silent reflux can also be a psychological burden, as sufferers often fear that their symptoms are more severe than they actually are or that they will never experience improvement. A correct diagnosis and effective treatment often also provide significant psychological relief. Those affected feel more in control of their health and can better focus on healing. Chapter 3. The role of nutrition in silent reflux. How certain foods worsen reflux symptoms. Diet plays a key role in the development and aggravation of reflux symptoms, especially silent reflux, LPR. Certain foods can increase pressure in the stomach, increase acid production, or weaken the lower esophageal sphincter, causing stomach acid to rise into the esophagus and throat. This particularly applies to foods that are acid-forming, difficult to digest, or have a relaxing effect on the sphincter. Acidic foods. Acidic foods can further irritate the mucous membranes in the throat and esophagus, worsening the symptoms of silent reflux. Acidic foods include citrus fruits such as oranges, lemons, grapefruits and their juices, tomatoes and tomato-based products such as ketchup, tomato sauces and tomato juice, vinegar and vinegar-containing products such as salad dressings and marinades. Consuming these foods leads to an increase in stomach acid production and can irritate the sensitive mucous membranes in the throat and larynx, worsening the symptoms of silent reflux. Fatty and fried foods. High fat and fried foods delay gastric emptying and increase pressure in the stomach, which promotes reflux. Such foods can also relax the esophageal sphincter, making it easier for stomach acid to rise. These include fried foods such as French fries, fried foods, donuts and fast food, fatty foods such as fatty meat, cream sauces, butter and cheese. These foods increase the risk of stomach acid refluxing into the esophagus, which is especially worse after eating large or fatty meals. Caffeinated drinks. Caffeine has a relaxing effect on the lower esophageal sphincter, which promotes the reflux of stomach acid. Caffeine-containing beverages also increase acid production in the stomach. Problematic beverages include coffee, including decaffeinated coffee, as it still contains a small amount of caffeine and acids. Black tea and other caffeinated teas. Cola and caffeinated soft drinks. These drinks can worsen reflux symptoms, especially when consumed in large quantities or on an empty stomach. Alcohol. Alcohol has a double negative effect on silent reflux. It stimulates stomach acid production and relaxes the lower esophageal sphincter, which promotes the reflux of stomach acid into the throat. Particularly harmful are wine, especially white wine, which has a high acidity, beer, which also increases acid production, spirits that strongly reduce sphincter tension. Even small amounts of alcohol can significantly worsen symptoms, especially if consumed in the evening or in combination with high-fat meals. Hot spices. Hot spices such as chili, pepper, paprika, and cayenne pepper can irritate the mucous membranes in the throat and esophagus, worsening reflux symptoms. They promote acid production and irritate the sensitive mucous membranes. Chocolate. Chocolate contains theobromine, a substance that relaxes the lower esophageal sphincter, allowing stomach acid to rise more easily. The fat content of chocolate also contributes to delayed gastric emptying, which can worsen reflux symptoms. Onions and garlic. Although onions and garlic are used as healthy ingredients in many dishes, they can trigger reflux symptoms in sensitive people. They promote acid production in the stomach and can also affect the esophageal sphincter. Identify and avoid trigger foods. To effectively reduce reflux symptoms, it's important to identify and avoid personal trigger foods. Triggers can vary from person to person, so it's helpful to pay attention to specific cues from the body and make individual dietary adjustments. Keeping a food diary. A food diary helps you determine which foods trigger or worsen reflux symptoms. Keeping track of what you eat and when symptoms occur can help you identify connections between specific foods and reflux. This allows you to specifically identify individual trigger foods. Avoiding common trigger foods. Once you've identified your trigger foods, try eliminating them from your diet or minimizing their consumption. The most common triggers include high-fat foods, fried foods, fatty meat, acidic foods, citrus fruits, tomatoes, vinegar, caffeinated drinks, coffee, cola, black tea, alcohol, hot spices, chocolate, onions and garlic. Trying low-acid alternatives. There are many low-acid foods and alternatives that can help control reflux symptoms. Some examples of reflux-friendly foods include green vegetables such as broccoli, spinach, cucumbers, zucchini and lettuce, non-citrus fruits such as bananas, melons, pears and apples without peel, lean meat such as chicken, turkey and fish, whole grain products such as oatmeal, whole wheat bread and brown rice, herbal teas such as chamomile tea or ginger tea, which have a calming effect on the stomach. Adjusting eating habits. In addition to avoiding trigger foods, it is also important to adjust eating habits. Smaller meals. Avoid large, heavy meals that overload your stomach. Instead, eat smaller portions more frequently throughout the day. Avoid late meals. Avoid large meals at least 2 to 3 hours before bedtime. This allows your stomach to digest the food better before you lie down. Eating slowly. Take your time while eating to aid the digestive process and reduce pressure on the stomach. Pay attention to your posture. You shouldn't lie down immediately after eating, as this encourages stomach acid reflux. It's advisable to stay upright after meals and allow at least 30 minutes before lying down. Summary: certain foods and beverages, such as coffee, fatty foods, alcohol, and citrus fruits, can worsen the symptoms of silent reflux by increasing stomach acid production, relaxing the sphincter, or putting pressure on the stomach. Avoiding these trigger foods and adjusting dietary habits are crucial for controlling reflux symptoms. Keeping a food diary can help identify individual triggers and make dietary changes more effective. The importance of a balanced acid-base balance. A balanced acid-base balance is crucial for overall well-being and, in particular, for controlling reflux symptoms. Acid-base balance refers to the balance between acidic and basic, alkaline, substances in the body, which is regulated by various mechanisms such as the kidneys, lungs, and digestive system. If this balance is disturbed and the body has to process too many acid-forming foods, this can increase stomach acid production and thus reflux. Acid-forming and alkaline foods. Foods influence the acid-base balance depending on how they are metabolized in the body. Some foods have an acid-forming effect, while others have an alkaline, basic effect. Here's an overview. Acid-forming foods. Meat and sausages. Dairy products such as cheese. Processed foods. White flour products. Sugar and sweets. Caffeinated drinks. Coffee, cola, alcohol, fats and oils. These foods can increase acid production in the stomach, increasing the risk of reflux. Excessive consumption of acid-forming foods can disrupt the acid-base balance and cause the body to become overacidic. Alkaline foods. Fruit except citrus fruits, especially bananas, melons and berries. Vegetables, especially green leafy vegetables such as spinach, broccoli and cucumbers. Potatoes and other root vegetables. Legumes, in moderation. Whole grain products. Nuts and seeds except peanuts. Alkaline foods help neutralize acidity in the body and promote a balanced environment that calms reflux and protects the mucous membranes in the gastrointestinal tract. The role of acid-base balance in reflux. An acid-base imbalance can lead to increased stomach acid production and irritation of the mucous membranes, which worsens reflux symptoms. A body stressed by consuming too many acid-forming foods often lacks enough alkaline reserves to neutralize the acid. This allows stomach acid to rise unhindered, contributing to symptoms such as silent reflux. Regular consumption of alkaline foods helps the body better manage excess stomach acid and reduce inflammation in the gastrointestinal tract. At the same time, balance is restored, counteracting reflux symptoms. Practical tips for a balanced acid-base balance. Increase your intake of alkaline foods. Include more fruits and vegetables, especially green leafy vegetables, in your diet. A high consumption of alkaline foods helps neutralize acid. Drink enough water. Water helps flush excess acids from the body and maintain balance. Reduce acid-forming foods. Avoid excessive consumption of coffee, alcohol, processed foods, and foods high in sugar. Balance in diet. Aim for a balanced diet that contains alkaline and acid-forming foods in a ratio that supports acid-base balance. Why medication alone is often not the solution. Although medications such as proton pump inhibitors, PPIs, and H2 blockers are often prescribed to reduce acid production in the stomach, medication alone is often not enough to resolve silent reflux in the long term. Here are the reasons why medication alone is often not a complete solution. Treating symptoms instead of fighting causes. Medications such as proton pump inhibitors and H2 blockers reduce the amount of stomach acid produced, which can provide short-term relief from reflux symptoms. However, they do not address the underlying causes of reflux, such as an unhealthy diet, obesity, stress, or a weakened esophageal sphincter. Therefore, without lifestyle or dietary changes, the problem persists, and reflux symptoms may return after stopping the medication. Long-term side effects. Long-term use of proton pump inhibitors and other acid-suppressing medications can lead to unwanted side effects, such as nutrient deficiencies. The reduction in stomach acid production can impair the absorption of important nutrients such as calcium, magnesium and vitamin B12, which can lead to deficiencies and health problems in the long term. For example, osteoporosis, increased risk of infection. Stomach acid plays an important role in protecting against infections by killing pathogens in the stomach. Long-term suppression of acid production can increase the risk of gastrointestinal infections, including increased susceptibility to bacteria such as Clostridium difficile. Rebound acid production. After discontinuing proton pump inhibitors, increased acid production may occur, which can worsen reflux symptoms. This is called rebound hypersecretion and can lead to a worsening of the problem. No solution for lifestyle and nutritional factors. A large proportion of reflux symptoms are caused by unhealthy lifestyle habits and diet. Factors such as excessive alcohol consumption, eating fatty or acidic foods, smoking, and stress contribute significantly to reflux. While medications can alleviate symptoms, without addressing these factors, the underlying cause remains. Sustainable relief of symptoms can only be achieved through changes in diet and lifestyle. Lifelong dependence on medication. When patients rely solely on medications to treat their reflux, they risk becoming permanently dependent on them. Many people take proton pump inhibitors for years without addressing the underlying causes. This often leads to lifelong dependence on these medications and a cycle in which symptoms recur once the medication is discontinued. Holistic approaches offer long-term solutions. Treatment of silent reflux should take a holistic approach that relies not only on medication but also on lasting lifestyle changes. These include dietary changes. A low-acid diet with plenty of fresh fruit and vegetables and few high-fat or processed foods can permanently relieve reflux. Weight management. Being overweight increases pressure on the stomach, which can worsen reflux. Weight loss can help reduce symptoms. Stress management. Stress can increase stomach acid production and impair digestion. Relaxation techniques such as yoga, meditation, or breathing exercises can help control reflux symptoms. Changes in eating habits. Eating smaller meals, eating slowly, and avoiding late meals can reduce the strain on the digestive system and relieve reflux. Summary. Acid-base balance is crucial for controlling reflux symptoms. Medication alone may provide short-term relief, but it doesn't address the root cause of the problem. While medications like proton pump inhibitors suppress stomach acid production, they carry long-term risks and do not prevent relapses. A lasting solution to silent reflux requires a comprehensive strategy that incorporates diet, lifestyle, and stress management. Only a holistic approach can achieve long-term symptom relief. Chapter 4. The basis of silent reflux nutrition. What to eat. Foods that soothe the stomach. With silent reflux, LPR, choosing the right foods plays a crucial role in relieving symptoms and soothing the stomach. Certain foods help neutralize stomach acid, protect the mucous membranes, and reduce inflammation. These foods are easily digestible, cause little to no acid production, and help maintain the body's acid-base balance. Oatmeal. Oatmeal is rich in fiber and an excellent choice for a gentle breakfast. It absorbs excess stomach acid and provides long-lasting satiety without putting too much strain on the stomach. Oatmeal is also alkalizing and promotes healthy digestion. Bananas. Bananas are an alkalizing fruit that soothes the stomach and balances the pH level. They have a low acid content and can help protect the mucous membranes in the esophagus and throat. They also provide important nutrients like potassium and fiber. Ginger. Ginger is a natural anti-inflammatory and can soothe the stomach. It aids digestion and reduces nausea and stomach acid. Ginger tea or small amounts of fresh ginger can help relieve reflux symptoms. Green vegetables. Green vegetables such as spinach, broccoli, cucumbers, zucchini, and green beans are alkalizing, low in fat, and high in fiber. These vegetables are easy to digest and help neutralize stomach acid. They also contain important vitamins and minerals that promote digestion. Melons. Melons such as honeydew melons, watermelons, and muskmelons are alkalizing and contain a lot of water, which helps dilute the acid concentration in the stomach. They are mild and gentle on the stomach, making them a good fit for a diet for silent reflux. Potatoes. Boiled potatoes are a gentle, alkalizing food choice. Cooked potatoes without fat or spicy seasoning soothe the stomach and, as part of a mild, low-fat meal, can reduce reflux. Potatoes also contain fiber, which aids digestion. Whole grain products. Whole grain foods like brown rice, quinoa, whole wheat bread, and oatmeal are rich in fiber and help soothe the stomach by absorbing excess acid. They promote healthy digestion and provide long-lasting energy without putting too much strain on the stomach. Lean meat and fish. Lean meats like chicken breast, turkey, and lean fish like salmon or cod are good sources of protein that won't overload the stomach. These foods are low in fat and easily digestible, which helps keep stomach acid production in check. It's important to prepare these foods steamed or baked, without fatty sauces or seasonings. Herbal teas. Herbal teas such as chamomile tea, fennel tea, or ginger tea have a soothing effect on the stomach and help regulate stomach acid. These teas do not contain caffeine, which could worsen reflux, and help relax the digestive system. Almonds. Unsalted. Almonds have an alkalizing effect and can help neutralize excess stomach acid. They are a healthy source of unsaturated fats and protein. However, it's important to consume them in moderation, as nuts are generally high in fat, which could trigger reflux symptoms if consumed in excess. Low-acid diet. How to do it right. A low-acid diet aims to choose foods that produce little to no acid or reduce acid levels in the stomach and body. This can help relieve the symptoms of silent reflux and support long-term digestive health. Here are the essential principles of a low-acid diet and tips for implementing them effectively. Avoid acid-forming foods. Acid-forming foods should be largely avoided or greatly reduced, as they can stimulate stomach acid production and worsen reflux symptoms. These foods include citrus fruits, oranges, lemons, grapefruit, tomatoes and tomato-based products, ketchup, tomato sauces, coffee and caffeinated beverages, alcohol, especially wine and beer, fatty and fried foods, hot spices such as chili, pepper and hot sauces, chocolate and sugary desserts. By reducing these foods, acid production in the stomach decreases, which minimizes irritation of the esophagus and throat. Prefer alkaline-forming foods. A low-acid diet involves the regular consumption of alkalizing foods that help balance the body's pH and neutralize excess acid. Examples of alkalizing foods include green vegetables, spinach, broccoli, cucumbers, root vegetables, carrots, sweet potatoes, legumes, lentils, beans, whole grain products, oat flakes, brown rice, non-citrus fruits, bananas, melons, berries, herbal teas, chamomile, fennel, ginger. These foods support an alkaline environment in the stomach and relieve reflux symptoms. Smaller meals, more frequently throughout the day. Large meals increase pressure on the stomach, which can promote stomach acid reflux. Instead of 3 large meals, it's advisable to eat smaller, more frequent meals throughout the day. This helps the stomach digest food more efficiently and reduces the risk of reflux symptoms. Eat slowly and chew thoroughly. Eating slowly and mindfully promotes digestion and reduces the likelihood of reflux. Chewing thoroughly helps break down food and facilitate digestion, reducing stomach acid production. Drink enough water. Drinking plenty of water helps dilute stomach acid and balance the body's pH. It's advisable to drink water in small sips throughout the day rather than consuming large amounts at once. Avoid late meals. Late meals, especially close to bedtime, increase the risk of reflux because your stomach doesn't have enough time to digest the food before you lie down. It's advisable to avoid large meals at least 2 to 3 hours before bedtime. Elevating the head while sleeping. When sleeping, your head should be slightly elevated to prevent stomach acid from refluxing. This can be achieved with special pillows or by raising the head of the bed. Stress management and relaxation techniques. Stress can increase stomach acid production and worsen reflux symptoms. Practices such as yoga, meditation, or deep breathing exercises can help reduce stress and calm the digestive system. Summary: foods that soothe the stomach, such as oatmeal, green vegetables, and herbal teas, are ideal for relieving reflux symptoms. A low-acid diet focuses on favoring alkalizing foods and avoiding acid-forming foods. Changing eating habits, such as small, frequent meals and eating slowly, also helps relieve symptoms. Combined with adequate water and relaxation techniques, a low-acid diet can help counteract silent reflux in the long term. The best nutrients for healthy digestion. Healthy digestion is crucial for well-being and controlling reflux symptoms, especially in cases of silent reflux, LPR. Certain nutrients support digestion, protect the lining of the gastrointestinal tract, and promote healthy gut flora. Here are the best nutrients to support healthy digestion. Fiber. Fiber is essential for healthy digestion because it regulates bowel activity, facilitates bowel movements, and supports the intestinal flora. There are two types of fiber, soluble and insoluble fiber, both of which are important for digestion. Soluble fiber. This fiber binds water and forms a gel-like substance in the digestive tract, softening stools and slowing digestion. It helps lower cholesterol and promotes a healthy intestinal environment. Sources of soluble fiber include oatmeal, flaxseed, apples, carrots, and legumes. Insoluble fiber. This fiber promotes the movement of food through the digestive tract and helps prevent constipation. It speeds up the movement of waste products and prevents harmful substances from accumulating in the intestines. Good sources include whole grains, nuts, seeds, and vegetables such as broccoli and green leafy vegetables. A diet rich in fiber helps keep the gastrointestinal tract moving and reduces the risk of digestive problems such as constipation, bloating, or heartburn. Probiotics. Probiotics are live bacterial cultures that support the gut flora and promote a balance of good bacteria in the digestive system. A healthy gut flora is crucial for digestion and helps reduce inflammation and strengthen the immune system. Sources of probiotics: yogurt with live cultures, kefir, sauerkraut, kimchi, kombucha, and other fermented foods contain probiotics. They help regulate the balance of microorganisms in the gut and prevent digestive disorders. Probiotics are particularly useful for people who frequently experience digestive problems or intestinal flora disturbances due to antibiotics or unhealthy eating habits. Prebiotics. Prebiotics are indigestible food components that promote the growth and activity of healthy gut bacteria. They serve as food for probiotics and help maintain a healthy gut microbiome. Sources of prebiotics. The best prebiotic foods include garlic, onions, leeks, asparagus, bananas, oats, and Jerusalem artichokes. These foods promote the growth of beneficial bacteria in the gut, which has a positive effect on digestion and overall health. Prebiotics in the diet not only improve digestion but also help relieve reflux symptoms by balancing the gastrointestinal system. Omega-3 fatty acids. Omega-3 fatty acids have anti-inflammatory properties that soothe the mucous membranes in the stomach and intestines and reduce inflammation. In people with silent reflux, omega-3 fatty acids can help reduce inflammation in the gastrointestinal tract and support digestion. Sources of omega-3 fatty acids. Fatty fish such as salmon, mackerel, herring, walnuts, chia seeds and flax seeds are rich in omega-3 fatty acids. Eating foods rich in omega-3 can help reduce inflammation in the gastrointestinal system and relieve reflux symptoms. Magnesium. Magnesium is a mineral important for muscle relaxation in the digestive system. It promotes proper function of the muscles in the digestive tract, including bowel movement, and helps prevent constipation. A magnesium deficiency can lead to digestive problems such as cramps and constipation. Sources of magnesium. Green leafy vegetables, spinach, chard, nuts, seeds, whole grains, bananas and avocados are excellent sources of magnesium. Magnesium contributes to smooth digestion by supporting the muscles of the digestive tract and promoting regular bowel movements. Zinc. Zinc is a trace element important for the healing and protection of mucous membranes in the gastrointestinal tract. It promotes tissue regeneration and supports the production of digestive enzymes necessary for the breakdown of nutrients. Sources of zinc: oysters, beef, chickpeas, pumpkin seeds and oatmeal are good sources of zinc. Adequate zinc levels help maintain the health of the digestive tract and promote the regeneration of damaged mucous membranes, which is particularly beneficial for reflux symptoms. Vitamin D. Vitamin D plays a key role in the immune system and digestive health. It helps regulate inflammatory responses in the body, which can be beneficial for silent reflux and other digestive disorders. Sources of vitamin D. In addition to sunlight, fatty fish such as salmon and mackerel, as well as fortified dairy products, are good sources of vitamin D. Adequate vitamin D levels support general health and contribute to normal digestive system function. Water. Adequate water is crucial for digestion and overall well-being. Water helps transport food through the digestive tract, protects the mucous membranes, and dilutes digestive juices in the stomach, which can reduce acidity. Drinking enough water is especially important for people with silent reflux to neutralize stomach acid. It is recommended to drink small amounts of water throughout the day rather than large amounts at once to aid the digestive process. Summary: the best nutrients for digestive health include fiber, probiotics, and prebiotics, which promote intestinal function and the balance of gut flora. Omega-3 fatty acids, magnesium, zinc, and vitamin D help reduce inflammation, protect mucous membranes, and support healthy digestion. Drinking enough water is also crucial for regulating stomach acid and easing digestion. A balanced diet containing these nutrients can not only improve digestion but also relieve reflux symptoms and promote overall well-being in the long term. Example nutrition plans for everyday life. A balanced diet plan for silent reflux should aim to soothe the stomach, aid digestion, and relieve reflux symptoms. Here's a daily meal plan with suggestions for breakfast, lunch, dinner, as well as snacks and small meals rich in nutrient-dense, low-acid, and stomach-friendly foods. Breakfast: oat flakes with banana and almonds. Ingredients: oat flakes, almond milk, 1 banana sliced, unsalted almonds, chopped, flax seeds. Why it helps: oatmeal is high in fiber and helps absorb excess stomach acid. Bananas soothe the stomach and are alkalizing, while almonds and flax seeds provide omega-3 fatty acids, which have anti-inflammatory properties. Whole grain toast with avocado. Ingredients: 1 slice of wholemeal bread, 1/2 avocado mashed, a pinch of salt and lemon juice. Why it helps: avocados are low in fat and alkalizing, which soothes the stomach. Whole grain bread provides valuable fiber, which aids digestion. Green smoothie with spinach and cucumber. Ingredients: 1 handful of spinach, 1/2 cucumber, 1 apple, peeled, 1 tablespoon of chia seeds, 200 milliliters of water. Why it helps: spinach and cucumber are alkaline and easy to digest. The apple provides a mild sweetness, and chia seeds contain omega-3 fatty acids that protect the mucous membranes. Lunch: grilled chicken with quinoa and steamed vegetables. Ingredients: grilled chicken fillet, lean, 1/2 cup quinoa, steamed vegetables, broccoli, carrots, zucchini. Why it helps: lean chicken is easy to digest and low in fat. Quinoa provides fiber and is alkalizing, while the vegetables are rich in vitamins and minerals that aid digestion. Sweet potato salad with chickpeas. Ingredients: cooked sweet potatoes, diced, chickpeas, canned, drained, spinach leaves, olive oil, a pinch of salt. Why it helps. Sweet potatoes are alkalizing and rich in fiber, while chickpeas contain prebiotics that promote healthy gut bacteria. Rice bowl with salmon and avocado. Ingredients: brown rice, baked salmon, omega-3 fatty acids, avocado, cucumber, sesame. Why it helps. Salmon contains omega-3 fatty acids, which have anti-inflammatory properties, while brown rice is high in fiber and avocado soothes the stomach. Dinner: steamed fish with potatoes and green vegetables. Ingredients: steamed cod or pike perch, boiled potatoes, steamed broccoli and green beans. Why it helps. Steamed fish is easy to digest and low in fat. Potatoes soothe the stomach, and the green vegetables have an alkalizing effect and promote healthy digestion. Zucchini noodles with ground turkey and tomato substitute. Ingredients: zucchini noodles, spiralized, lean ground turkey, tomato substitute. For example, a paprika-based sauce. Olive oil. Why it helps. Zucchini noodles are light and alkalizing, while turkey is low in fat and easily digestible. The tomato substitute avoids the acid found in tomatoes. Lentil soup with carrots and celery. Ingredients: red lentils, carrots, celery, a pinch of turmeric, herbs such as parsley. Why it helps. Lentils are a good source of fiber and prebiotics, while the carrots and celery are alkalizing and support digestion. Turmeric has anti-inflammatory properties. Snacks and small meals. Unsalted nuts and seeds. Ingredients: almonds, walnuts, sunflower seeds. Why it helps. Nuts and seeds are rich in healthy fats and fiber. Almonds also have an alkalizing effect that soothes the stomach. Enjoyed in small amounts, they are ideal as a snack. Apple slices with almond butter. Ingredients: 1 apple, peeled and sliced, 1 tablespoon almond butter. Why it helps. Apples are high in fiber and low in acid, while almond butter provides healthy fats that are gentle on the stomach. Cucumber with hummus. Ingredients: fresh cucumber slices, chickpea hummus. Why it helps. Cucumbers are alkalizing and easy to digest, while hummus contains prebiotics that promote gut health. Whole grain crackers with avocado dip. Ingredients: whole grain crackers, mashed avocado, a pinch of salt. Why it helps. Whole grain crackers provide fiber, and avocado has alkalizing properties that soothe the stomach and aid digestion. Rice crackers with quark. Ingredients: unsalted rice crackers, low-fat quark. Why it helps. Rice crackers are light and low in fat, while cottage cheese is a good source of protein that soothes the stomach and is easy to digest. Summary: this everyday silent reflux meal plan offers easily digestible, nutrient-dense meals that help soothe the stomach and relieve reflux symptoms. Foods like oatmeal, lean meats, alkalizing vegetables, and healthy fats like avocado or omega-3 rich fish support digestion and promote a healthy balance in the gastrointestinal tract. Chapter 5: Foods to avoid. Acid-forming foods. Why they worsen the problem. Acid-forming foods are those that, after digestion and metabolism, leave acidic residues in the body and stimulate the production of stomach acid. These added acids can significantly worsen the symptoms of silent reflux, LPR, by irritating the stomach and esophagus and promoting reflux. Consuming these foods causes the stomach to produce more acid, increasing the risk of stomach acid rising up into the esophagus and throat. Reasons why acid-forming foods worsen reflux. Increased stomach acid production. Acid-forming foods promote the production of stomach acid, which increases the risk that the acid can overcome the esophageal sphincter and rise into the throat. This leads to irritation and inflammation in the throat, larynx, and sometimes also the airways, triggering typical reflux symptoms such as coughing, sore throat, and hoarseness. Weakening of the lower esophageal sphincter, LES. The lower esophageal sphincter is the muscle that separates the stomach from the esophagus and normally prevents stomach acid from rising. Certain acid-forming foods weaken this muscle, allowing stomach acid to flow back into the esophagus more easily, causing reflux symptoms. Irritation of mucous membranes. The acids and irritating substances contained in acid-forming foods can directly irritate the mucous membranes in the esophagus, throat, and even the respiratory tract. This worsens the symptoms of silent reflux and often leads to inflammation, burning, and discomfort. Digestive overload. Acid-forming foods put a strain on the digestive system, which can lead to delayed gastric emptying. When the stomach functions more slowly, the risk of stomach acid backing up into the esophagus increases. Examples of acid-forming foods. Citrus fruits, oranges, lemons, grapefruits and their juices are highly acidic and can significantly increase stomach acid production. Tomatoes and tomato-based products. Tomatoes, tomato sauces, ketchup and similar products have a high acid content and aggravate reflux symptoms. Processed and fried foods. These put a lot of strain on the stomach and led to increased acid production while slowing down digestion. Foods high in sugar. Sugar can trigger increased acid production in the stomach and should also be avoided or reduced. Coffee, alcohol and chocolate. The most common pitfalls. Certain stimulants, such as coffee, alcohol, and chocolate, are considered particularly problematic for silent reflux because they can trigger or worsen reflux. These commonly consumed foods are often difficult to avoid, but their effects on the stomach and esophagus make them the most common pitfalls in combating reflux symptoms. Coffee. Coffee is one of the most common triggers for reflux symptoms, and this is due to several factors. Decaffeinated coffee can also worsen the problem. Why coffee worsens reflux? Acidity. Coffee contains acids that can stimulate stomach acid production and irritate the stomach lining. This increases the amount of acid in the stomach and promotes the acid rising into the esophagus. Caffeine. Caffeine is a stimulant that relaxes the lower esophageal sphincter, LES, making it less effective at preventing the reflux of stomach acid. Pro-inflammatory effect. Coffee can increase inflammation in the digestive tract and worsen the symptoms of silent reflux. Alternative. Herbal teas such as chamomile or fennel tea are soothing for the stomach and a good alternative for people who are sensitive to coffee. Alcohol. Alcohol is one of the most common and potent triggers of reflux symptoms. Even small amounts of alcohol can worsen symptoms. Why alcohol worsens reflux? Relaxation of the lower esophageal sphincter, LES. Alcohol weakens the esophageal sphincter, allowing stomach acid to flow back into the esophagus. This promotes acid regurgitation and causes symptoms such as a sore throat, cough, and hoarseness. Increased stomach acid production. Alcohol stimulates the production of stomach acid, which increases the risk of reflux. Irritant effect on mucous membranes. Alcohol can directly irritate the delicate mucous membranes in the esophagus and throat, causing inflammation. This can worsen reflux symptoms, especially with regular alcohol consumption. Particularly harmful types of alcohol, beer and wine, have a high acid content, which aggravates reflux symptoms. Hard alcoholic drinks like whiskey or rum severely weaken the sphincter. Alternative: instead of alcohol, you can drink still water, herbal teas, or alkaline drinks such as diluted almond milk. Chocolate. Chocolate is another treat that can trigger or worsen reflux, mainly due to the ingredients theobromine and fat. Why chocolate worsens reflux? Theobromine. This substance, which is found in chocolate, relaxes the lower esophageal sphincter and thus increases the risk of stomach acid rising into the esophagus. Caffeine. Chocolate also contains small amounts of caffeine, which can further weaken the anal sphincter. High fat content. Chocolate, especially milk chocolate, contains a lot of fat. Fat slows digestion, leading to delayed gastric emptying. This increases pressure in the stomach and can promote acid reflux. Alternative: dark chocolate, with a lower fat and sugar content, may be a less problematic choice for some people. However, it should also be consumed in moderation to avoid reflux symptoms. Summary: acid-forming foods such as citrus fruits, tomatoes, and sugar increase stomach acid production and weaken the lower esophageal sphincter, which can worsen silent reflux symptoms. Stimulants such as coffee, alcohol, and chocolate are common pitfalls, as they trigger or worsen reflux. Coffee and chocolate contain acids and stimulants that increase acid production and relax the sphincter, while alcohol both stimulates stomach acid production and irritates the esophagus. Avoiding or reducing these foods is crucial for relieving and controlling reflux symptoms in the long term. Fatty, fried and processed foods. Fatty, fried, and highly processed foods are known triggers for reflux symptoms, especially in cases of silent reflux, LPR. These foods burden the stomach, increase stomach acid production, and slow digestion. Here's a more detailed explanation of why these foods are problematic and how they worsen reflux symptoms. Fatty foods. Fatty foods, especially those containing saturated and trans fats, slow down gastric emptying. When food stays in the stomach longer, pressure on the lower esophageal sphincter, LES, increases, increasing the risk of stomach acid rising into the esophagus. Examples: butter, cheese, cream sauces, fatty meat, fast food, chips, pizza and baked goods such as croissants or puff pastry. Fried foods. Fried foods are particularly difficult to digest because they contain a lot of fat and take longer for the stomach to process. This leads to increased gastric acid production and can weaken the lower esophageal sphincter, which promotes the reflux of stomach acid into the esophagus. Examples: French fries, fried chicken, donuts, fried onion rings, tempura and spring rolls. Processed foods. Highly processed foods often contain large amounts of fat, salt, sugar, and artificial additives that burden the digestive system. These foods are not only difficult to digest, but can also promote inflammation in the digestive tract and increase stomach acid production. Furthermore, many processed foods contain trans fats, which weaken the sphincter. Examples: ready meals, frozen pizza, hot dogs, sausages, chips, ready-made sauces, cookies, sweets, breakfast cereals with high sugar content. Effects on reflux. Delayed gastric emptying. Fatty and fried foods stay in the stomach longer, which increases pressure on the esophageal sphincter and promotes reflux. Weakening of the sphincter. Fat and some additives in processed foods weaken the lower esophageal sphincter, allowing stomach acid to rise more easily. Increased stomach acid production. These foods stimulate the production of stomach acid, which increases the risk of reflux symptoms such as cough, sore throat, and hoarseness. Tips to make abstinence easier. Giving up fatty, fried, and processed foods can be challenging for many people, especially if they are heavily accustomed to these habits. Here are some helpful tips to make it easier to avoid these foods while promoting a healthy, stomach-friendly diet. Find healthier alternatives. Instead of completely giving up your favorite foods, look for healthier alternatives. Bake instead of fry. Many foods that are usually fried can also be baked in the oven to reduce the fat content. For example, you can prepare potatoes as baked potatoes instead of French fries. Use healthier fats. When cooking, use healthier fats like olive oil or avocado oil, which are easier to digest and cause fewer problems than saturated fats and trans fats. Low-fat alternatives. Choose low-fat dairy products, such as low-fat yogurt or low-fat cheese, and lean meats, skinless chicken or turkey, to reduce fat intake. Change slowly. Changes in diet should be made gradually to make abstinence more sustainable. One step at a time. Start by cutting down on some particularly fatty or processed foods and replacing them with healthier options. You don't have to give up everything immediately. You can adjust your eating habits gradually. Replace one meal a day, instead of eating 3 fried meals or snacks a day. First reduce one meal and replace it with a healthier, low-fat alternative. Prepare healthy snacks. Plan your snacks in advance to avoid temptation. Instead of reaching for chips, fries, or processed snacks, prepare healthy alternatives. Fresh fruits and vegetables. Fruits such as apples, pears and berries or vegetable sticks, carrots, cucumbers, with a dip of hummus or yogurt are healthy and delicious alternatives. Unsalted nuts. A small handful of unsalted nuts such as almonds or walnuts provides healthy fats and promotes satiety without putting a strain on the stomach. Try new cooking methods. Experiment with new cooking methods to make it easier to avoid fried foods. Steaming and grilling. Steaming and grilling are gentle cooking methods that enhance the flavor of food without putting a strain on the stomach. Slow cooker. Use a slow cooker to prepare healthy, low-fat meals that are gentle on the stomach. Vegetable and lentil dishes, stews, and lean meats can be cooked slowly and prepared with just a few spices and oil. Find enjoyable alternatives. Try to see the abstinence as an opportunity to discover new, delicious and healthy recipes. Many healthy meals can be just as enjoyable as fatty or fried foods. Spices and herbs. Use fresh herbs and spices to spice up your meals and add flavor without using high-fat sauces or frying methods. Filling soups and salads. Make soups and salads a regular part of your meals. They are light, low in fat, and can be varied with healthy ingredients like legumes, lean meat, and vegetables. Keep an eye on the benefits. Remind yourself why you're trying to abstain. Think about the health benefits. Better digestion. By avoiding fatty and fried foods, your digestion will improve and you will suffer less from reflux symptoms. More energy. A low-fat and balanced diet often leads to more energy and better overall well-being. Long-term health. In the long term, avoiding fatty, fried, and processed foods can reduce the risk of cardiovascular disease, obesity, and other health problems. Planning and preparation. Good planning and preparation help to avoid temptations and resort to healthy alternatives. Plan your weekly menu. Plan your meals for the week in advance to ensure you have all the healthy ingredients on hand and avoid the temptation to reach for processed or fatty foods. Stock up. Keep healthy foods and snacks on hand so you don't reach for unhealthy options when you're hungry. Summary. Fatty, fried, and processed foods are difficult to digest and increase the risk of reflux symptoms. By eliminating these foods, you can significantly reduce the symptoms of silent reflux. Healthy alternatives, a gradual transition, and healthy meal planning can make abstinence easier. New cooking methods, healthy snacks, and a focus on the health benefits help ensure long-term success and improve well-being. Chapter 6. Recipes for a reflux-friendly diet. Breakfast ideas to start the day well. A stomach-friendly breakfast is the best way to start the day, especially for people with silent reflux. These breakfast ideas help soothe the stomach, are nutrient-dense, and promote healthy digestion without aggravating reflux symptoms. Oat flakes with banana and flaxseed. Ingredients: oat flakes, almond milk, or oat milk, 1 banana sliced, 1 tablespoon flaxseed. Why it helps. Oatmeal is high in fiber and helps absorb stomach acid, which can reduce reflux symptoms. Bananas are alkalizing and gentle on the stomach, while flax seeds provide healthy fats and aid digestion. Green smoothie with spinach and cucumber. Ingredients: 1 handful of spinach, 1/2 cucumber, 1 apple, peeled, 1 tablespoon of chia seeds, 200 milliliters of water. Why it helps. Spinach and cucumber are alkalizing and promote healthy digestion. The apple adds sweetness and fiber to the smoothie, while chia seeds contain omega-3 fatty acids, which have anti-inflammatory properties. Whole grain toast with avocado. Ingredients: 1 slice of wholemeal bread, 1/2 avocado, a pinch of salt. Why it helps. Avocado is low in fat and alkalizing, which soothes the stomach. Whole grain bread provides fiber, which can aid digestion and reduce reflux. Yogurt with oat flakes and berries. Ingredients: low-fat yogurt without sugar, 2 tablespoons of oat flakes, a handful of blueberries or strawberries. Why it helps. Natural yogurt contains probiotics that promote gut health. Oatmeal and berries provide fiber and antioxidants that soothe the stomach and reduce inflammation. Scrambled eggs with spinach. Ingredients: 2 eggs, 1 handful of spinach, 1 teaspoon of olive oil. Why it helps. Eggs are a good source of protein that fills you up without weighing you down. Spinach is alkaline and easily digestible, which reduces reflux symptoms. Lunch dishes that are filling and gentle. Lunches should be nutrient-dense, filling, and easy to digest to protect your stomach and avoid reflux symptoms. Here are some stomach-friendly lunch ideas that will fill you up without causing discomfort. Grilled chicken with quinoa and vegetables. Ingredients: grilled chicken breast, lean, 1/2 cup quinoa, steamed broccoli, carrots and zucchini. Why it helps. Lean chicken is easy to digest and low in fat, while quinoa is rich in fiber and gentle on the stomach. The vegetable provides important vitamins and minerals and has an alkalizing effect. Sweet potato salad with chickpeas. Ingredients: cooked sweet potatoes, diced, chickpeas, drained, spinach leaves, olive oil, a pinch of salt. Why it helps. Sweet potatoes are alkalizing and high in fiber, which soothes the stomach. Chickpeas contain plant-based protein and fiber, which aid digestion and keep you full for longer. Rice bowl with salmon and avocado. Ingredients: brown rice, steamed salmon, avocado, cucumber, sesame. Why it helps. Salmon provides anti-inflammatory omega-3 fatty acids that protect mucous membranes, while brown rice contains fiber for digestive health. Avocado and cucumber are easily digestible and alkalizing. Vegetable soup with lentils. Ingredients: red lentils, carrots, celery, zucchini, parsley, a pinch of turmeric. Why it helps. Lentil soup is easy to digest, high in fiber, and filling. Vegetable soup soothes the stomach, and turmeric has anti-inflammatory properties. Zucchini noodles with tomato substitute and ground turkey. Ingredients: zucchini noodles, spiraled, lean ground turkey, paprika sauce, as a tomato substitute, olive oil. Why it helps. Zucchini noodles are alkaline and easy to digest, and ground turkey is low in fat and gentle on the stomach. The tomato substitute made from bell peppers avoids the acids found in tomatoes, which reduces reflux. Summary: these breakfast and lunch ideas combine easily digestible and nutrient-dense foods that are gentle on the stomach and support healthy digestion. Oatmeal, whole grains, lean meats, sweet potatoes, and alkalizing vegetables are ideal for starting the day well and soothing the stomach. These recipes are gentle on the stomach and help reduce reflux symptoms while providing satiety and energy. Light dinners without reflux risk. A light dinner is especially important to avoid reflux symptoms, as the stomach needs time to digest food before bedtime. The following dinners are easy to digest, gentle on the stomach, and minimize the risk of reflux. Steamed fish with potatoes and green vegetables. Ingredients: steamed cod or pike perch, boiled potatoes, steamed broccoli and green beans. Why it helps. Fish is easy to digest and low in fat, which is gentle on the stomach. Potatoes are alkalizing and soothe the stomach, while broccoli and green beans provide valuable nutrients that aid digestion. Quinoa salad with avocado and cucumber. Ingredients: cooked quinoa, diced avocado, cucumber, a dash of lemon juice and olive oil. Why it helps. Quinoa is high in fiber and alkalizing, which aids digestion. Avocado and cucumber are easy to digest, low in fat, and gentle on the stomach, while olive oil provides healthy fats. Lentil soup with carrots and celery. Ingredients: red lentils, carrots, celery, parsley, a pinch of turmeric. Why it helps. Lentil soup is easy to digest and filling because it's rich in fiber and protein. The carrots and celery are alkalizing and help settle the stomach, while turmeric has anti-inflammatory properties. Grilled turkey breast with steamed vegetables. Ingredients: grilled turkey breast, lean, steamed broccoli, zucchini and carrots. Why it helps. Turkey breast is low in fat and easy to digest, while steamed vegetables like broccoli and carrots are alkalizing and help neutralize stomach acid. Zucchini noodles with chicken and paprika sauce. Ingredients: spiralized zucchini, grilled chicken breast, paprika sauce as a tomato substitute. Why it helps. Zucchini noodles are alkalizing and light, while chicken breast is low in fat and gentle on the stomach. Paprika sauce is a low-acid alternative to tomato sauce and reduces the risk of acid reflux. Snacks for in between. Snacking doesn't have to mean risking reflux symptoms. Here are stomach-friendly snacks that are easy to digest and healthy. Apple slices with almond butter. Ingredients: 1 apple, peeled and sliced. 1 tablespoon almond butter. Why it helps. Apples without the skin are high in fiber and alkalizing, while almond butter provides healthy fats that soothe the stomach. Cucumber with hummus. Ingredients: fresh cucumber slices. Hummus. Why it helps. Cucumbers are easy to digest and have alkalizing properties, while hummus made from chickpeas is high in fiber and aids digestion. Unsalted nuts. Ingredients: almonds, walnuts, cashew nuts, in small quantities. Why it helps. Nuts are a good source of healthy fats and proteins that keep you full for longer. Almonds also have alkalizing properties that can reduce reflux symptoms. Whole grain crackers with avocado dip. Ingredients: whole grain crackers, mashed avocado, a pinch of salt. Why it helps. Whole grain crackers provide fiber, while avocado is alkalizing and soothes the stomach. This is a filling and light snack. Rice crackers with low-fat quark. Ingredients: unsalted rice crackers, low-fat quark. Why it helps. Rice crackers are easy to digest and low in fat, while curd is a good source of protein that is filling and easy on the stomach. Banana slices with flax seeds. Ingredients: 1 banana, 1 teaspoon flaxseed. Why it helps. Bananas are alkalizing and soothe the stomach, while flax seeds provide omega-3 fatty acids, which have anti-inflammatory properties and aid digestion. Summary: light dinners like steamed fish with vegetables, quinoa salad, or zucchini noodles are ideal for reducing the burden on your stomach before bedtime and minimizing the risk of reflux. Snacks like apple slices with almond butter, cucumbers with hummus, or unsalted nuts are easy to digest and gentle on your stomach. These ideas help you get through the day without putting a strain on your digestion or triggering reflux symptoms. Drinks that help, and those you should avoid. Certain beverages can help soothe the stomach, aid digestion, and relieve reflux symptoms. These drinks are low in acid, gentle on the stomach, and promote a balanced acid-base balance. Water. Why it helps. Water is the best drink for hydrating the body and diluting excess stomach acid. It helps soothe mucous membranes and neutralize stomach acid. Be sure to drink small amounts of water regularly throughout the day to avoid overloading your stomach. Ginger tea. Why it helps. Ginger has anti-inflammatory properties and is known to aid digestion and reduce nausea and stomach acid. Homemade ginger tea is an excellent choice for people with reflux. Chamomile tea. Why it helps. Chamomile tea soothes the stomach and helps reduce inflammation in the digestive tract. It's mild and helps reduce stomach acid production, which reduces reflux symptoms. Fennel tea. Why it helps. Fennel tea soothes the stomach and can relieve bloating and indigestion. It's alkalizing and supports digestion, reducing the risk of reflux symptoms. Oat milk. Why it helps. Oat milk is naturally alkaline and rich in fiber, which helps neutralize stomach acid. It's a good alternative to cow's milk, which is often acidic and can trigger reflux in some people. Diluted almond milk. Why it helps. Almond milk is alkalizing and helps soothe the stomach. It has a low acid content and can relieve reflux symptoms. Use unsweetened and diluted almond milk to avoid overburdening the stomach. Coconut water. Why it helps. Coconut water is alkaline and rich in electrolytes. It soothes the stomach, reduces acid production, and is a good hydrating alternative to acidic drinks. Drinks you should avoid. Some beverages can increase stomach acid production, weaken the lower esophageal sphincter, and worsen reflux symptoms. These beverages should be avoided or severely limited in cases of silent reflux. Coffee. Why it's bad. Coffee contains acids and caffeine, which stimulate stomach acid production and relax the lower esophageal sphincter. This increases the risk of stomach acid flowing back into the esophagus and causing reflux symptoms like heartburn and coughing. Alcohol. Why it's harmful. Alcohol weakens the lower esophageal sphincter and increases stomach acid production, which promotes acid reflux into the esophagus. Wine, beer, and high-proof alcoholic beverages are particularly harmful and can worsen reflux. Carbonated drinks. Why it's bad. Carbonated beverages like sodas, soft drinks, and mineral water increase pressure in the stomach, which increases the risk of reflux symptoms. The carbon dioxide can also irritate the stomach lining and cause bloating. Citrus juices. Why it's harmful. Citrus fruit juices like orange, lemon, and grapefruit have a high acid content, which stimulates stomach acid production and irritates the mucous membranes in the esophagus and stomach. These juices significantly worsen reflux symptoms. Black tea and green tea, with caffeine. Why it's bad. Black and green tea contain caffeine, which weakens the lower esophageal sphincter and stimulates stomach acid production. These teas can worsen reflux symptoms, especially when consumed in large quantities. Full-fat dairy products. Why it's bad. Full-fat milk and dairy products like cream and whole milk increase the fat content in the stomach, which slows digestion and increases pressure on the stomach. This promotes the reflux of stomach acid and worsens reflux symptoms. Summary. Drinks like water, herbal teas, ginger, chamomile, fennel, and alkaline alternatives like almond milk and coconut water are ideal for soothing the stomach and reducing reflux symptoms. Avoid coffee, alcohol, carbonated drinks, citrus juices, and caffeinated teas, as they can increase stomach acid production and worsen reflux. Conscious beverage choices help control reflux symptoms and improve overall well-being. Chapter 7. Further measures to relieve silent reflux. The role of proper eating habits, meal times and portion sizes. Proper eating habits play a crucial role in relieving reflux symptoms, especially silent reflux, LPR. How and when you eat can affect digestion and help prevent stomach acid reflux. Here are the key points to keep in mind. Eat smaller portions, more often. Large meals put pressure on the stomach, increasing pressure on the lower esophageal sphincter, and promoting reflux of stomach acid into the esophagus. Eating smaller meals more frequently throughout the day can help reduce this pressure and facilitate the digestive process. Why it helps. The stomach has to work less to digest smaller portions, which reduces the risk of reflux symptoms such as heartburn and coughing. Tip. Eat 5-6 small meals a day instead of 3 large meals. Avoid late meals. Late meals increase the risk of reflux because your stomach doesn't have enough time to digest food before you lie down. Lying down makes it more likely that stomach acid will flow back into your esophagus because gravity no longer helps keep stomach contents down. Why it helps? If you don't eat anything for at least 2-3 hours before bedtime, you give your stomach enough time to digest the food before you lie down. Tip: plan dinner early in the evening, ideally between 6 o'clock and 7 p.m. Slow, conscious eating. Eating quickly leads to swallowing more air, which can lead to bloating and pressure in the stomach, which in turn promotes reflux. Eating slowly also better signals to the brain when you're full, reducing the risk of overeating. Why it helps? Eating slowly promotes digestion and helps relieve stomach congestion. Chewing thoroughly reduces stress on the digestive system and reduces the likelihood of reflux symptoms. Tip: take at least 20-30 minutes at each meal to eat slowly and chew well. Eat in an upright position. Lying down after eating increases the likelihood of stomach acid rising into the esophagus. It's better to stay upright after eating to allow gravity to assist the digestive process. Why it helps? Sitting or standing upright after eating prevents the reflux of stomach acid because gravity keeps the stomach contents in the stomach. Tip: stay upright for at least 30 minutes after meals and avoid lying down immediately. Avoid large amounts of drinks during meals. Drinking a lot while eating can overload the stomach and increase pressure on the lower esophageal sphincter, which promotes reflux. Why it helps? Drinking smaller amounts of fluid during meals prevents the stomach from becoming overdistended, which minimizes acid reflux. Tip: drink larger amounts of fluids between meals rather than during them. Stress reduction and its importance for digestion. Stress plays a central role in the development and exacerbation of digestive problems, including reflux. The body responds to stress with a variety of physiological changes that can increase stomach acid production and impair digestion. How stress affects digestion. Increased stomach acid production. Stress can increase stomach acid production, increasing the risk of reflux symptoms. When the body is stressed, it produces more stomach acid to prepare for potential danger, a legacy from the days when the human body was primed for fight or flight response in stressful situations. Delayed gastric emptying. During stress, the digestive process slows down because the body goes into fight or flight mode and deems digestion less important. This causes food to stay in the stomach longer, increasing the risk of reflux. Weakened immune system. Chronic stress can weaken the immune system, making the body more susceptible to inflammation and digestive disorders. Inflammation in the gastrointestinal tract can irritate the mucous membranes and worsen reflux symptoms. Stress reduction for healthy digestion. Healthy stress management can significantly improve digestion and relieve the symptoms of silent reflux. Here are some techniques that may help. Breathing exercises and meditation. Deep breathing and mindfulness meditation calm the nervous system and reduce stress, which in turn lowers stomach acid production. Breathing exercises help put the body into a state of relaxation in which digestion functions optimally. Tip: practice deep abdominal breathing for 5-10 minutes a day or right before eating to aid digestion. Progressive muscle relaxation. This technique helps release tension in the body caused by stress. By specifically tensing and relaxing different muscle groups, you can reduce physical tension that affects digestion. Tip: perform progressive muscle relaxation in the morning or before bedtime to relax your body. Yoga. Yoga combines physical exercise with mindfulness and breathing techniques, which has a positive effect on digestion. Certain yoga poses promote gastric emptying and reduce pressure on the stomach, which relieves reflux symptoms. Tip: gentle yoga exercises such as the child's pose or cobra can stimulate digestion and calm the stomach. Exercise and walking. Moderate exercise promotes digestion by keeping the gastrointestinal tract moving and moving stomach contents more quickly. Regular walks after meals help relieve stomach congestion and prevent reflux symptoms. Tip: take a 10 to 20 minute walk after eating to aid digestion. Adequate sleep. Stress and sleep deprivation are closely linked. Adequate sleep improves overall health and supports digestion. Sleep deprivation can increase stress hormones, which negatively impact digestion and worsen reflux. Tip: create a relaxing sleep routine to reduce stress and improve sleep quality. Long-term effects of stress on digestion. Chronic stress can lead to long-term digestive disorders and increase the risk of stomach problems such as gastritis, stomach ulcers, and reflux. Persistent overproduction of stomach acid can damage the mucous membranes in the digestive system and worsen the symptoms of silent reflux. Targeted stress reduction can normalize digestion and minimize the risk of long-term damage. Adjust sleeping habits. Raise your head. Breathe better. Adjusting your sleeping habits is crucial to preventing reflux symptoms, especially at night. Since lying down promotes the natural flow of stomach acid, certain sleeping positions and breathing techniques can help relieve symptoms. Keep your head elevated. Elevating your head while sleeping is one of the most effective ways to reduce reflux symptoms at night. Elevating your head and upper body makes it harder for stomach acid to flow back into your esophagus due to gravity. Why it helps. Lying down makes it easier for stomach acid to flow back into the esophagus, causing symptoms like heartburn, sore throat, or coughing. Elevating the head and upper body helps keep the stomach acid in the stomach and reduces esophageal irritation. How it works. Use a wedge pillow that raises your head and upper body by about 15-20 cm. This helps utilize gravity to prevent reflux. Alternatively, you can raise the head of the bed slightly by placing blocks or books under the bedposts. Important. Regular pillows are often insufficient, as they can cause the neck to bend uncomfortably. A special wedge pillow or raising the entire upper body is more effective. Sleep on the left side. Sleeping position has a significant impact on reflux symptoms. Sleeping on your left side can help prevent reflux, while sleeping on your right side or on your back can worsen symptoms. Why it helps. The valve that opens into the stomach, the lower esophageal sphincter, is located on the left side of the stomach. Sleeping on your left side keeps stomach acid lower in the stomach, making it harder for it to reflux. Sleeping on your right side can have the opposite effect, as it allows stomach acid to more easily rise into the esophagus. Tip: get into the habit of sleeping on your left side to relieve reflux symptoms. A body pillow can help maintain this position throughout the night. Breathing techniques for better sleep and digestion. Deep, conscious breathing can relax the body, improve digestion, and reduce reflux symptoms, especially before bedtime. Stress and shallow breathing can strain the digestive tract and increase stomach acid production. Why it helps. Deep breathing promotes relaxation and reduces stress, which often increases stomach acid production. Breathing exercises help activate the parasympathetic nervous system, which supports digestion and prepares the body for rest and sleep. Tip: before going to bed, Practice deep abdominal breathing or breathing techniques like the 4, 7, 8 method. Inhale for 4 seconds. Hold for 7 seconds. Exhale for 8 seconds. These breathing techniques calm the nervous system and promote restful sleep. Other lifestyle changes that help. In addition to sleep habits, there are other important lifestyle changes that can help relieve and control reflux symptoms in the long term. These changes include diet, exercise, and general habits. Weight management. Being overweight can increase the risk of reflux because it increases abdominal pressure and weakens the lower esophageal sphincter. Losing excess weight, especially in the abdominal area, can help relieve pressure on the stomach and reduce reflux. Why it helps? Pressure on the abdomen from excess fat can cause stomach acid to flow back into the esophagus more easily. Weight loss relieves pressure on the gastrointestinal tract and lower esophageal sphincter. Tip: try to achieve and maintain a healthy weight through a combination of a healthy diet and regular exercise. Even small weight losses can have a big impact on reflux symptoms. Quit smoking. Smoking is a strong risk factor for reflux symptoms because nicotine weakens the lower esophageal sphincter and increases stomach acid production. The smoke itself can further irritate the mucous membranes in the esophagus and worsen inflammation. Why it helps? Quitting smoking can strengthen the lower esophageal sphincter and normalize stomach acid production. This reduces the likelihood of acid rising up into the esophagus. Tip: use support programs or nicotine replacement therapy to help you quit smoking. Giving up cigarettes can significantly improve your reflux symptoms and your overall health. Reduce alcohol consumption. Alcohol weakens the lower esophageal sphincter and increases stomach acid production, which can significantly worsen reflux symptoms. Beer, wine, and spirits are particularly harmful. Why it helps? Reducing or completely avoiding alcohol can help strengthen the lower esophageal sphincter and reduce irritation of the mucous membranes. Tip: replace alcohol with stomach-friendly drinks like herbal teas or still water. Avoid alcohol, especially in the evening, to prevent nighttime reflux symptoms. Regular exercise. Moderate physical activity promotes digestion and helps control body weight, which can reduce reflux symptoms. Exercise helps the digestive tract function more effectively and reduces pressure in the stomach. Why it helps? Regular exercise promotes gastric emptying and prevents food from staying in the stomach for too long, reducing the risk of reflux symptoms. Tip: aim for 30 minutes of moderate exercise, such as walking, cycling, or swimming. However, avoid vigorous exercise immediately after meals, as this can worsen reflux. Wear loose clothing. Tight clothing, especially around the abdomen, can increase pressure on the stomach and trigger reflux symptoms. Loose clothing that doesn't press on the abdomen relieves pressure on the stomach and reduces pressure on the lower esophageal sphincter. Why it helps? Clothing that doesn't press on the stomach reduces pressure on the stomach and esophagus, which reduces the risk of reflux. Tip: wear comfortable, loose-fitting clothing, especially after eating, to avoid pressure on your stomach. Stress management. Stress increases stomach acid production and can negatively affect the digestive tract. Chronic stress worsens reflux symptoms and can cause long-term damage. Stress management techniques such as meditation, yoga, and breathing exercises can help relieve reflux symptoms. Why it helps? Reducing stress reduces stomach acid production and promotes healthy digestion, which can significantly reduce reflux symptoms. Tip: integrate daily relaxation exercises into your daily routine, such as yoga or mindfulness meditation, to manage stress and support digestion. Summary: adjusting your sleeping habits, such as elevating your head and sleeping on your left side, can significantly reduce reflux symptoms. Additionally, other lifestyle changes such as weight management, avoiding smoking and alcohol, regular exercise, wearing loose clothing, and stress reduction can help control reflux long-term and improve your quality of life. A holistic approach to diet, sleep, and general habits can significantly reduce the symptoms of silent reflux. Chapter 8: Life without reflux: the path to permanent freedom from symptoms. Long-term strategies to keep reflux at bay. Reflux, especially silent reflux, LPR, can be kept under control long-term through a combination of dietary changes, lifestyle modifications, and targeted stress management. It's all about developing sustainable habits that prevent reflux and promote overall well-being. Here are some proven long-term strategies. Permanent dietary change. A healthy, balanced diet is crucial to regulate gastric acid production and control reflux in the long term. Avoid acid-forming foods. Reduce your consumption of acidic foods such as citrus fruits, tomatoes, caffeinated beverages, fatty and fried foods, and chocolate. These foods can weaken the lower esophageal sphincter and increase stomach acid production. Favor alkaline and easily digestible foods. Choose alkaline foods such as green leafy vegetables, oatmeal, bananas, quinoa, and lean meat. These promote digestion and prevent irritation in the gastrointestinal tract. Balanced meals. Ensure a healthy balance of fiber, protein, and healthy fats. A balanced diet supports digestion and reduces the risk of reflux. Small, frequent meals. Large meals increase pressure in the stomach and promote reflux symptoms. Instead, eat smaller, more frequent meals throughout the day. Why it helps. Smaller portions relieve pressure on the stomach and prevent pressure on the lower esophageal sphincter from becoming too great, which reduces the risk of gastric acid reflux. Long-term change. Plan 5-6 small, nutritious, and easily digestible meals per day. This promotes healthy digestion and helps keep reflux at bay permanently. Stress management. Stress plays a major role in worsening reflux symptoms. Long-term stress management can help regulate stomach acid production and prevent relapses. Deep breathing and meditation. Regular breathing exercises and mindfulness meditation calm the nervous system and reduce the production of stress hormones that impair digestion. Exercise and relaxation. Physical activity such as yoga, walking, or gentle stretching promotes relaxation and improves digestion. Daily exercise also helps reduce stress and maintain a healthy gastrointestinal tract. Improve sleep quality. Adequate, restful sleep is important for well-being and digestion. Ensure you get 7-9 hours of sleep per night and your sleeping environment is quiet and relaxing. Weight management. Excess weight, especially in the abdominal area, can increase pressure on the stomach and increase the likelihood of reflux symptoms. Maintaining a healthy weight can help control reflux in the long term. Healthy weight loss. If you are overweight, you should try to lose weight through a combination of a healthy diet and regular exercise. Even a small weight loss can have a significant impact on reflux. Long-term weight control. Continuously monitoring your weight and avoiding yo-yo dieting are crucial to getting reflux under control permanently. Physical activity. Regular moderate exercise helps support digestion, regulate metabolism and improve overall well-being. Why it helps. Exercise promotes gastric emptying and prevents food from staying in the stomach for too long. This reduces the risk of reflux. Long-term integration. Incorporate moderate exercise such as walking, cycling, or swimming into your daily routine. However, avoid strenuous exercise immediately after meals, as this can trigger reflux. Permanently adjust sleeping habits. In the long term, you should ensure that your sleeping habits minimize reflux. Elevate your head. Continue using a wedge pillow or raise the head of the bed to prevent stomach acid from refluxing while you sleep. Sleeping on your left side. Sleeping on your left side is most effective for keeping stomach contents down and preventing reflux. How to prevent relapses. Relapses are common with reflux, especially if the underlying triggers aren't completely avoided. Here are some targeted measures to prevent relapses. Early detection of symptoms. Look for early signs of reflux, such as a slight burning sensation in your chest, a sore throat, frequent throat clearing, or a nighttime cough. The sooner you recognize these symptoms, the sooner you can take action. Immediate measures. If you notice symptoms returning, try switching to light, alkaline foods immediately and possibly avoiding trigger foods for a few days. Avoid known triggers. If you know your personal triggers for reflux, try to consistently avoid them. These include certain foods. For example, coffee, chocolate, fried foods, and lifestyle factors, late meals, stress, mindful eating. Pay attention to your eating habits and make sure you eat slowly, chew well, and don't consume too large portions at once. Slow return to potential triggers. If you avoid certain foods or drinks but later want to reintroduce them in small amounts, you should do so slowly and carefully to avoid relapse. Tip. Test potential trigger foods like tomatoes or coffee in very small amounts and observe how your body reacts. Only increase the amount if no symptoms occur. Maintain routine. A consistent routine regarding meals, exercise and sleep can help keep reflux under control. Regular meal times. Stick to regular meal times and avoid skipping meals or eating late. Plan your diet so that you don't eat anything at least 2-3 hours before bedtime. Take medication only after consultation. If your doctor has prescribed medications such as proton pump inhibitors, PPIs, or H2 blockers, take them as directed. Do not stop abruptly. Instead, reduce your dosage gradually in consultation with your doctor to avoid rebound symptoms. Tip. If necessary, combine medication with lifestyle changes for best results. Regular checkups. Visit your doctor regularly to monitor your reflux symptoms and ensure no long-term damage occurs. This is especially important if you already have chronic reflux or complications such as esophagitis. Why it helps. Regular checkups help identify potential problems early and treat them before they get worse. Summary. Long-term strategies to keep reflux under control include a permanent change in diet, regular exercise, stress management, and adjusting sleep habits. The focus is on preventative measures such as avoiding triggers and maintaining a healthy lifestyle to prevent relapses. Recognizing early signs and maintaining a consistent routine will help reduce and control reflux symptoms in the long term. Success stories. People who were healed through nutrition. Many people have managed to significantly reduce or even completely cure their reflux symptoms through targeted dietary and lifestyle changes. Here are some success stories that demonstrate how effective nutritional therapy can be when applied consistently. Maria, 42 years old. From daily heartburn to freedom from symptoms through dietary changes. Maria had been suffering from daily heartburn and silent reflux for over 5 years. She struggled with a cough and sore throat, especially at night. Her doctor prescribed proton pump inhibitors, but these only provided short-term relief. After consulting a nutritionist, she decided to radically change her diet. Dietary change. Maria reduced her intake of acidic foods like citrus fruits, tomatoes, coffee, and chocolate. Instead, she incorporated alkaline foods like leafy greens, bananas, oatmeal, and quinoa. She also avoided fried and fatty foods, replacing them with lean meat, fish, and whole grain products. Result: within 3 months, Maria experienced a significant improvement in her symptoms. She was able to stop taking her medication and no longer had reflux symptoms, even at night. By eating slowly and mindfully and avoiding late meals, she also felt more energetic and generally healthier. Thomas, 35 years old, healing silent reflux through a plant-based diet. Thomas was an athletically active man who frequently suffered from hoarseness and a sore throat without the classic symptoms of heartburn. After numerous visits to an ENT specialist, he was diagnosed with silent reflux. Thomas did not want long-term medication and decided to change his diet. Dietary change. Thomas switched to a largely plant-based diet. He reduced meat and dairy products and focused on a diet rich in vegetables, legumes, whole grains, and healthy fats from avocados and nuts. He also drank chamomile tea and ginger water daily to soothe his stomach. Result: after about 4 months, his hoarseness improved, and his sore throat disappeared. He noticed that plant-based foods were less irritating to his stomach and he felt lighter overall. Thomas now attributes his reflux-free state to his plant-based, low-fat diet. Carla, 50 years old, reflux-free through weight reduction and dietary adjustments. Carla struggled with obesity and severe reflux, especially after eating, for several years. She took regular medication, but the symptoms kept recurring. Her doctor advised her to change her diet and lose weight. Dietary changes and weight management. Carla began a combination of a calorie-conscious, low-fat diet and regular exercise. She eliminated processed foods, alcohol, and caffeinated beverages and focused on lean proteins, whole grains, and plenty of vegetables. She also reduced her portion sizes and ate smaller, more frequent meals. Result: after 6 months, Carla had lost 12 kilograms, and her reflux symptoms had completely disappeared. After another 12 months, she remained symptom-free, was able to discontinue her medication, and felt significantly better physically and mentally. Stefan, 28 years old, exercise and nutrition against reflux. Stefan began suffering from reflux and nighttime heartburn in his mid-20s. Due to his stressful job and irregular eating habits, his symptoms worsened, especially during stressful periods. Instead of relying on medication, he wanted to change his lifestyle. Diet and exercise changes. Stefan gradually changed his diet and began avoiding sugary and fried foods. He incorporated fiber-rich foods like oatmeal, whole grain bread, and plenty of fruits and vegetables into his meals. He also began exercising regularly, especially moderate cardio training like jogging and cycling. Result: within 4 months, his heartburn disappeared completely. Stefan felt healthier, more balanced, and fitter. He attributes his successful reflux treatment to a combination of a healthy diet and regular exercise. Lisa, 60 years old. Success through intermittent fasting and alkaline nutrition. Lisa struggled with heartburn and reflux for decades. Despite several attempts at medication and diets, the symptoms kept recurring. On the advice of a friend, she tried intermittent fasting and a predominantly alkaline diet. Dietary change. Lisa began intermittent fasting, 16:8, where she ate in an 8-hour window and fasted for 16 hours. She focused on an alkaline diet with plenty of vegetables, whole grains, nuts, and seeds, and avoided acid-forming foods like sugar, alcohol, and highly processed foods. Result: after just 2 months, Lisa noticed significant improvements. Her nighttime heartburn disappeared, and she no longer had any digestive problems. She has been reflux-free for over a year and finds intermittent fasting sustainable and enjoyable. Conclusion: these success stories demonstrate that a targeted dietary change combined with lifestyle changes such as stress management, exercise, and sleep adjustments can be effective in alleviating or curing reflux symptoms in the long term. Each person has unique triggers and reacts differently to certain foods, but a balanced, healthy diet with a focus on alkaline and easily digestible foods has proven effective in many cases. Long-term discipline and mindfulness of one's own body are crucial for success. Chapter 9. Frequently asked questions and myths about silent reflux. Is silent reflux really curable? Silent reflux, laryngopharyngeal reflux, LPR, is a chronic condition caused by the backflow of stomach acid and digestive enzymes into the throat and airways. Unlike classic reflux, which often presents with heartburn, the symptoms of silent reflux are often more subtle, such as a sore throat, hoarseness, cough, or difficulty breathing. Whether silent reflux is completely curable depends on several factors. Curability and individual differences. A cure is possible, but not guaranteed. For some people, silent reflux can actually be alleviated to the point of lasting symptom relief through targeted lifestyle and dietary changes, as well as stress management. Especially when symptoms are caused by dietary or habitual triggers, these can be managed through targeted changes in eating habits, sleep, and stress management. Long-term control rather than complete cure. In many cases, silent reflux cannot be completely cured in the sense of a permanent disappearance of symptoms. Instead, the disease can be controlled long-term through a healthy lifestyle and a modified diet. People who pay attention to their triggers and avoid certain habits such as late meals, acidic foods, and overeating can live reflux-free. Early treatment increases the chances of success. The earlier silent reflux symptoms are detected and treated, the better the chances of completely eliminating the symptoms or controlling them long-term. However, prolonged, untreated reflux can cause long-term damage such as inflammation or changes in the mucous membranes that are more difficult to reverse. Drug-free treatment through diet and lifestyle. Silent reflux can often be controlled without long-term medication, especially if the triggers are managed through lifestyle changes. Dietary changes. A low-acid, alkaline-rich diet with easily digestible foods is the most important approach to alleviating reflux symptoms. Avoiding highly acidic or fatty foods, caffeine, alcohol, and large meals can significantly reduce symptoms. Adjust your sleeping habits. Elevating your upper body while sleeping and sleeping on your left side will help prevent stomach acid reflux during the night. Stress management. Stress contributes significantly to the worsening of reflux symptoms because it increases stomach acid production. Stress reduction through meditation, yoga, or breathing exercises can help control reflux. Do you always need medication? No, you don't always need medication to treat silent reflux. The need for medication depends on the severity of the symptoms, individual triggers, and the success of lifestyle changes. When medication is necessary. Severe or advanced symptoms. If silent reflux symptoms are severe, persist for a long time, or lead to complications, such as inflammation or tissue damage in the throat or esophagus, medication may be temporarily necessary to quickly relieve symptoms and aid the healing process. For acute symptom relief, medications such as proton pump inhibitors, PPIs, or H2 blockers are often used to reduce stomach acid production and allow the affected mucous membranes time to heal. These medications are particularly useful when symptoms severely impact daily life or when rapid intervention is necessary to prevent further damage. Long-term medication use. Medications are not a permanent solution. Although medications such as proton pump inhibitors can be effective, they are generally not a long-term solution. Long-term medication use can have side effects, such as nutrient deficiencies, for example, vitamin B12 or magnesium, an increased risk of infections, and digestive upset. Therefore, it is often beneficial to use medications only temporarily while simultaneously addressing the underlying causes of reflux through lifestyle changes. Gradual withdrawal. Many people taking medication for reflux can successfully reduce or stop taking it after a while by consistently adjusting their diet and lifestyle. It's important to withdraw the medication gradually to avoid a so-called rebound effect, in which stomach acid production suddenly increases sharply. Alternative approaches. There are many alternative approaches that can help people get by without medication. Natural remedies. Some people find relief through natural remedies such as chamomile tea, ginger tea, aloe vera juice, or fennel. These soothe the stomach and have anti-inflammatory properties. Probiotics. Building a healthy gut flora by consuming probiotics. For example, in yogurt, kefir, or fermented foods, can help improve digestion and reduce reflux. Nutritional counseling. A professional nutritionist can help develop a customized diet plan that minimizes reflux and leads to long-term symptom improvement. Conclusion. Is silent reflux curable and does one always need medication? For many people, silent reflux can be significantly alleviated or even completely controlled through lifestyle and dietary adjustments. While a complete cure is not always guaranteed, many sufferers can reduce their symptoms so much through consistent daily adjustments that they can live permanently symptom-free. Medication is usually not always necessary and should only be used if symptoms are severe or difficult to control. In the long term, however, dietary changes, stress management, and healthy habits are key to managing reflux and preventing relapses. How quickly do dietary changes work? The effectiveness of dietary changes for silent reflux, LPR, can vary and depends on several factors, such as the severity of symptoms, the consistency of dietary adjustments, and individual triggers. However, there are some general timeframes that can serve as a guide. Short-term improvements within 1-2 weeks. Reducing reflux symptoms. Many people experience noticeable improvement in symptoms after just a few days to weeks, especially when they eliminate highly acidic foods such as coffee, chocolate, fried foods, and alcohol from their diet. Reducing these triggers relieves pressure on the stomach and reduces reflux. Soothing the mucous membranes. When alkaline and stomach-friendly foods such as oatmeal, bananas, green vegetables and low-fat proteins are incorporated into the diet, the irritated mucous membranes in the esophagus and throat can begin to recover. Medium-term improvement. After 4-8 weeks. Greater symptom relief. After about 1 month of consistent dietary changes, you should notice a significant reduction in symptoms such as coughing, hoarseness, or sore throat. Heartburn may also be less frequent or severe. During this phase, the gastrointestinal tract begins to stabilize, and the regeneration of irritated mucous membranes is more advanced. Getting used to new eating habits. At this point, the body has better adapted to the new eating habits, and digestion should be easier overall. The risk of reflux episodes can be significantly reduced. Long-term control. After 3-6 months. Stable. Long-term improvement. After 3 to 6 months, many people can achieve stable, long-term control of their reflux symptoms. When combined with other lifestyle changes, for example, weight management, sleep adjustments, dietary changes can lead to a largely symptom-free life. Reduction or elimination of medication. During this phase, many people can reduce or even eliminate the need for medications such as proton pump inhibitors, especially if dietary changes are successful and symptoms disappear. Myths about acidic and alkaline foods. There are many myths surrounding acidic and alkaline foods that can lead to confusion, especially when it comes to controlling reflux. Here are some common misconceptions and the scientific facts behind them. Myth 1. All acidic foods are bad for reflux. Fact. Not all acidic foods are automatically bad for reflux. Some acidic foods, such as tomatoes or citrus fruits, can worsen symptoms in sensitive people, but it often depends on the individual response. There are acidic foods that, in small amounts or as part of a balanced diet, may not have negative effects. The pH of a food alone does not determine whether it triggers reflux. Reality. Foods like vinegar and citrus fruits should be avoided by sensitive individuals, but that doesn't mean they are problematic for everyone. It's important to identify personal triggers and not avoid all acidic foods across the board. Myth 2. All alkaline foods prevent reflux. Fact. Alkaline foods like leafy greens, potatoes, and bananas can soothe the stomach and relieve reflux symptoms. However, alkaline doesn't automatically mean a food will help everyone. Other factors such as fat content, portion size, and individual sensitivities also play a role. Reality. Alkaline foods are generally helpful for reflux, but they are not the only solution. A healthy balance between alkaline and low-acid foods, as well as adjusting eating habits, are crucial for success. Myth 3. The pH of the food determines whether it causes reflux. Fact. The pH of a food before consumption isn't the only factor that determines whether it causes reflux symptoms. How the body metabolizes the food is important. For example, citrus fruits or acidic drinks can trigger reflux symptoms, but other acidic foods like fermented products, for example, yogurt, can actually have a calming effect by supporting the gut flora. Reality. The acidity of a food affects symptoms differently in different people. Foods like yogurt, which contain acidic components, can soothe the stomach because they contain probiotics and aid digestion. Myth 4. Alkaline diet cures all digestive problems. Fact. A predominantly alkaline diet can significantly alleviate reflux symptoms, but it alone is not a universal solution for all digestive problems. Many factors, such as stress, genetic predisposition, meal times, and sleep habits, play a role in the development and treatment of reflux. Reality. An alkaline diet is an important component of reflux treatment, but other lifestyle factors must also be considered. Dietary changes should be combined with other measures such as sleep and stress management. Myth 5. There are fixed rules for acidic and alkaline foods. Fact. Foods can't always be strictly classified as acidic or alkaline. Some foods that taste sour, like lemons, actually have an alkalizing effect in the body, while other foods that appear neutral can be metabolized as acidic. The key is to observe individual reactions. Reality. The pH of a food before digestion can differ from its effect in the body. Lemons, for example, have an alkalizing effect in the body even though they taste sour. It's important to observe your body's reactions rather than relying solely on lists of acidic and alkaline foods. Conclusion. Dietary changes can have a rapid effect, with initial improvements often noticeable after just 1 to 2 weeks. However, long-term success and complete control of reflux symptoms can take several months and require consistent implementation. Myths about acidic and alkaline foods can lead to misunderstandings. While alkaline foods are often considered helpful for reflux, individual responses are crucial. The pH of a food alone does not always determine whether it causes or relieves reflux. A holistic approach that considers diet, lifestyle, and individual needs is key to successful reflux treatment. Chapter 10. Checklists and Practical Help. Shopping list for a reflux-friendly diet. This shopping list contains foods that soothe the stomach, are easy to digest, and help reduce reflux symptoms. It includes alkaline, low-fat, and high-fiber foods that can easily be incorporated into a 7-day meal plan. Fruit, bananas, apples, peeled, pears, melons, honeydew melon, watermelon, berries, blueberries, raspberries, strawberries, vegetables, spinach, broccoli, zucchini, cucumbers, sweet potatoes, carrots, celery, green salad, for example arugula, lettuce, peppers, yellow, green, avocado, cereals and whole grain products, oatmeal, wholemeal bread, whole grain rice, quinoa, spelt bread, proteins, lean chicken breast fillet, lean turkey meat, salmon, grilled or steamed, cod or pike perch, steamed, tofu, plain, legumes, chickpeas, lentils, eggs, organic, low-fat, milk and milk alternatives, low-fat yogurt without sugar, almond milk, unsweetened. Oat milk, unsweetened. Reduced fat cottage cheese. Fats and oils. Olive oil, extra virgin. Avocado oil. Flaxseed, whole or ground. Snacks and nuts. Unsalted almonds. Walnuts. Sunflower seeds. Drinks. Still water. Chamomile tea. Fennel tea. Ginger tea. Coconut water. Spices and herbs. Fresh herbs. Parsley. Dill. Basil. Turmeric. Cumin. Ginger. Fresh or ground. Meal plan for 7 days. This meal plan is designed to be reflux-friendly, reducing stomach acid production and soothing the stomach. The meals are easy to digest, low in fat, and nutrient-dense. Day 1. Breakfast. Oat flakes with almond milk, banana and flax seeds. Snack. Unsalted almonds. Lunch. Quinoa salad with avocado, cucumber, peppers and olive oil. Snack. Apple slices with almond butter. Dinner. Steamed salmon with sweet potatoes and steamed broccoli. Day 2. Breakfast. Wholemeal bread with avocado and a boiled egg. Snack. Pear. Lunch. Grilled chicken breast with quinoa and steamed spinach. Snack. Cucumbers with hummus. Dinner. Zucchini noodles with ground turkey and paprika sauce. Day 3. Breakfast. Yogurt with oat flakes and blueberries. Snack. Rice cakes with almond butter. Lunch. Lentil soup with carrots, celery and parsley. Snack. Banana pieces with flax seeds. Dinner. Grilled cod with brown rice and zucchini. Day 4. Breakfast. Smoothie made from almond milk, spinach, cucumber and pear. Snack. Walnuts. Lunch. Grilled chicken with sweet potatoes and avocado. Snack. Rice cakes with cottage cheese. Dinner. Vegetable soup with lentils, carrots and spinach. Day 5. Breakfast. Oat flakes with oat milk, apple and flaxseed. Snack. Almonds. Lunch. Grilled salmon with quinoa and steamed broccoli. Snack. Apple slices. Dinner. Tofu with brown rice and steamed carrots. Day 6. Breakfast. Wholemeal bread with avocado and a soft boiled egg. Snack. Cucumber slices with hummus. Lunch. Grilled turkey breast with quinoa and broccoli. Snack. Pear. Dinner. Zucchini noodles with ground turkey and paprika sauce. Day 7. Breakfast. Yogurt with oat flakes and strawberries. Snack. Rice cakes with cottage cheese. Lunch. Lentil soup with carrots and celery. Snack. Walnuts. Dinner. Steamed cod with sweet potatoes and steamed vegetables. Daily routines to control symptoms. These daily plans take into account important factors such as meal times, rest periods, and stress-reducing measures to keep reflux symptoms under control. Example daily routine 1. 7:30 a.m. Breakfast. Oatmeal with almond milk, banana and flax seeds. Take your time to eat slowly and chew well. Avoid overly large portions. 10 a.m. Snack. A small handful of unsalted almonds. Enjoy the snack consciously and drink still water or fennel tea with it. 12:30 p.m. Lunch. Quinoa salad with avocado, cucumber and olive oil. Take a 10-15 minute walk after eating to aid digestion. 3 p.m. Snack. Apple slices with almond butter. Drink a glass of still water or chamomile tea. 6 p.m. Dinner. Steamed salmon with sweet potatoes and broccoli. Avoid lying down immediately after eating. Stay upright and relaxed. 9 p.m. Before bed. Drink a cup of chamomile or ginger tea to settle your stomach. Sleep on your left side with your upper body elevated, for example, with a wedge pillow. Example daily routine 2. 8 o'clock breakfast. Smoothie made from almond milk, spinach, cucumber and pear. Avoid drinking too quickly to prevent bloating. 10:30 a.m. Snack. Pear and a small handful of walnuts. Drink still water to aid digestion. 1 p.m. Lunch. Grilled chicken with quinoa and steamed spinach. After eating, take a 15-minute walk or do some light exercise. 3:30 p.m. Snack. Rice cakes with hummus or cottage cheese. Drink fennel tea to soothe digestion. 6:30 p.m. Dinner. Zucchini noodles with ground turkey and paprika sauce. Eat at least 2-3 hours before bedtime to avoid nighttime reflux. 9 p.m. Before going to bed, drink fennel or chamomile tea. Avoid going to bed immediately after dinner. Wait at least 2-3 hours. Conclusion. A 7-day meal plan and a conscious daily routine with small, alkaline meals help relieve reflux symptoms. Make sure you eat small, regular meals, eat slowly, and avoid late meals to control symptoms long term. Combining diet, exercise, and good sleep habits is the key to a smooth, reflux-free daily routine. Keeping a personal reflux diary. How to do it. Keeping a reflux diary is an effective way to identify individual triggers of reflux symptoms, track the effects of dietary and lifestyle changes, and develop personalized treatment. By documenting your daily eating habits, symptoms, and activities, you can identify patterns that can help you better control reflux. Here's how to keep such a diary and which points are especially important. Why keep a reflux diary? Identifying triggers. Keeping a diary will help you identify which foods, drinks, or habits trigger reflux symptoms. Monitoring progress. You can document the effects of dietary changes or medications and see which measures improve or worsen your symptoms. Better overview. A reflux diary gives you a structured overview of your daily diet and lifestyle, which helps you to be more conscious about your health. Medical support. A well-maintained diary is a useful tool for discussing specific measures to control reflux with your doctor or nutritionist. What belongs in the reflux diary? To capture the right information, you should document a few key points daily. Here are the most important categories to include in your journal. Date and time. Record the exact date and time of each meal, snack, and activity. This will help identify temporal relationships between your meals and the onset of reflux symptoms. Meals and drinks. What did you eat? Keep a detailed list of the foods you ate at each meal or snack. Also note the cooking methods: fried, grilled, steamed, and seasonings. What did you drink? Keep track of what you consumed. For example, water, tea, coffee, soft drinks, alcohol. It's especially important to document beverages like coffee, alcohol, or carbonated drinks, as they often trigger reflux. Portion sizes. Note whether you ate a small, medium, or large portion. Large meals increase pressure on the stomach and can worsen symptoms. Symptoms and severity. Symptoms. Write down any symptoms you have noticed. For example, heartburn, cough, sore throat, hoarseness, belching, nausea. Time of symptoms. When did the symptoms begin? How long did they last? Severity. Rate the severity of symptoms on a scale of 1, mild, to 10, very severe. This scale helps you better identify changes over time. Activities after meals. What did you do after eating? Note whether you went straight to bed, exercised, or sat down after eating. Activities like lying down immediately after eating can worsen reflux symptoms. Physical activity. Record whether you exercised or engaged in any physical activity that day. For example, walking, intense exercise. Exercise affects digestion and reflux. Stress level. How stressed were you? Write down how stressed you felt that day. Stress can increase stomach acid production and worsen reflux. Use a scale of 1, very relaxed, to 10, very stressed, to rate your stress level. Sleeping habits. How did you sleep? Note what time you went to bed and whether you slept with your upper body elevated. Sleeping position and habits play an important role in controlling reflux symptoms, especially at night. Nighttime symptoms. Have you experienced reflux symptoms during the night? For example, nighttime heartburn, cough, or sore throat? Medicines and dietary supplements. Have you taken any medications? Note if and when you have taken medications for reflux or other health problems. For example, proton pump inhibitors, antacids, H2 blockers. Dietary supplements. If you are taking dietary supplements, for example, probiotics, ginger, vitamin D, document this as well to identify any possible effects on your symptoms. Conclusion. My personal experiences with silent reflux, motivation and encouragement for those affected. Silent reflux, laryngopharyngeal reflux, LPR, can severely impact daily life. Symptoms often occur unexpectedly and without the typical heartburn, making diagnosis difficult and potentially prolonging the suffering. Frequent hoarseness, constant throat clearing, sore throat, or nighttime coughing are stressful for many sufferers, leaving them searching for a solution. But there is hope. My personal experiences with silent reflux. I, too, struggled with silent reflux. The symptoms crept on gradually. At first, just an occasional sore throat, then a more frequent nighttime cough. For a long time, I didn't understand that it was related to my diet and habits. After seeing numerous doctors and trying various treatment options, I realized that by changing my diet and lifestyle, I could regain control of my health. The decision to keep a reflux diary and gradually identify trigger foods was a turning point for me. By eliminating highly acidic foods, adjusting my sleep habits, and managing stress, I was able to not only significantly reduce my symptoms but also improve my overall well-being. It was a journey that required patience, but the positive changes in my life have been more than worth it. Motivation and encouragement for those affected. If you're struggling with silent reflux, I want to offer you encouragement. It can often feel like the symptoms are endless and there's no solution, but there are ways to take control of your health. Here are some things that have helped me on my journey and that may help you too. Give yourself time. Changes don't happen overnight. Dietary and lifestyle changes take time to take effect. Be patient with yourself and don't expect instant miracles. You may see initial improvements after just a few weeks. Get to know your body. Everyone reacts differently to foods and habits. Keeping a reflux diary can help you identify your personal triggers and understand which changes really make a difference. Small steps count. Big changes can seem overwhelming, but you don't have to change everything at once. Start small. cutting out a handful of reflux trigger foods first and see how your body reacts. Focus on long-term solutions. Medications can provide short-term relief, but lasting improvement requires sustained lifestyle changes. A balanced diet, regular exercise, stress reduction, and good sleep hygiene are the cornerstones of reflux control. Encourage yourself. It's easy to get discouraged by symptoms, but remind yourself that you are in control. Every positive step you take brings you closer to relieving your symptoms. Celebrate small successes and believe that a symptom-free future is possible. Final thoughts. Silent reflux may be a silent companion, but it doesn't have to dominate your life. With the right tools, a conscious diet, and a mindful lifestyle, you can regain control. You are not alone on this journey. Many people have managed to alleviate their symptoms, and you can too. Trust your body, listen to it, and give yourself the time you need to sustainably improve your health. Don't give up. Every step counts. Attachment. Important sources and literature. Understanding silent reflux, laryngopharyngeal reflux, LPR, and successfully treating it requires in-depth knowledge of nutrition, digestion, and managing reflux symptoms. Here are some scientific studies, books, and other resources that are useful for delving deeper into the topic. Books on reflux and nutrition. Dropping Acid, The Reflux Diet Cookbook and Cure by Dr. Jamie Kaufman and Jordan Stern. This book provides detailed information about the causes of silent reflux and introduces a specific diet plan that can relieve reflux symptoms. It includes numerous low-acid recipes for sufferers. The Acid Watcher Diet by Dr. Jonathan Aviv. Dr. Aviv, a renowned otolaryngologist, explains how silent reflux symptoms develop and how a low-acid diet can provide long-term relief. The book also includes useful advice on lifestyle changes. The Complete Anti-Inflammatory Diet for Beginners by Dorothy Kalimaris. This resource provides practical nutritional guidance for an anti-inflammatory diet that can help relieve reflux symptoms by targeting the inflammatory nature of the condition. Scientific articles and studies. Kaufman, J.A., et al., 2010. Prevalence of laryngopharyngeal reflux symptoms in patients with persistent throat symptoms. This article examines the prevalence of laryngopharyngeal reflux symptoms in patients with persistent throat symptoms and explains how often the disease goes undiagnosed. L. Serad, H.B., 2014. Gastroesophageal reflux disease. The New England Journal of Medicine. A comprehensive study on gastroesophageal reflux diseases and their effects, including an analysis of silent reflux and treatment strategies. Aviv, J. 2017. Laryngopharyngeal reflux. Comprehensive review of diagnosis, pathophysiology, and treatment. This article provides a deeper analysis of the causes and treatment options for silent reflux and highlights how diet and lifestyle can influence the course of the disease. Further links and contacts. Here are some trusted online resources and organizations that offer helpful information and support on silent reflux. German Society for Gastroenterology. Digestive and Metabolic Diseases, DGVS. Website, https://www.dgvs.de. The DGVS offers current information on gastroesophageal reflux diseases, including diagnostics and treatment approaches for silent reflux. Here you will find specialist information and current research findings. American Academy of Otolaryngology, Head and Neck Surgery. Website: https://www.entnet.org. The AAOHNS is one of the leading organizations for otolaryngologists and offers comprehensive information on laryngopharyngeal reflux, diagnosis, and treatment options. Acid Watcher Dr. Jonathan Aviv. Website: https://www.acidwatcher.com. Dr. Aviv's website contains valuable information and resources for treating reflux through diet, lifestyle changes, and medical approaches. Allergy, gastrointestinal and nutritional advice. Website: https://www.refluxgate.de, a platform specifically dedicated to reflux diseases, including silent reflux. Here you will find testimonials and helpful tips on the reflux diet, specialists and nutritionists for silent reflux. Treating silent reflux often requires collaboration between specialists, nutritionists, and possibly other healthcare providers. Here are some tips for finding the right professionals. Specialists in ear, nose and throat medicine and ENT specialists are usually the first point of contact when symptoms of silent reflux, such as hoarseness, chronic cough, or throat clearing, occur. They can perform tests such as laryngoscopy to check the condition of the throat and larynx. How to find the right specialist? Use online portals such as Jameda, www.jameda.de, to find specialists in your area and read reviews from other patients. Ask about specific experience with LPR, as not every ENT doctor specializes in this specific problem. Gastroenterologists. Gastroenterologists specialize in gastrointestinal diseases and can diagnose and treat the underlying causes of reflux, including silent reflux. They often perform tests such as pH measurements or endoscopies. Where to find a gastroenterologist? The German Society for Gastroenterology, Digestive and Metabolic Diseases, DGVS, offers directories of specialists. You can find out about specialized gastroenterologists through doctor reviews on platforms such as Sonego, www.sonego.de. Nutritionist. A registered dietitian can help you develop a customized diet to relieve your reflux symptoms. A dietitian can guide you through incorporating alkaline and low-acid foods and teach you proper portion control. How to find the right nutritionist? The German Nutrition Society, DGE, offers a directory of certified nutritionists. Visit the website at https://www.dge.de. Make sure the nutritionist has experience with reflux patients, as silent reflux requires a specialized nutritional strategy. Integrative medicine naturopath. In some cases, integrative medicine practitioners or naturopathic physicians may also be helpful in pursuing a holistic treatment approach that combines dietary changes, stress management, and natural remedies. Where to find integrative medicine? Naturopathic practices or integrative medicine clinics that take a holistic approach and provide support for gastrointestinal complaints and reflux symptoms. Inquire about nutritional approaches and herbal remedies such as ginger, aloe vera or probiotics. Conclusion. Proper treatment and control of silent reflux begins with sound information and professional support. By consulting relevant literature, studies, and specialists, you can develop personalized strategies to help you regain control of your health. Nutritionists, gastroenterologists, and ENT specialists can help you treat the causes of reflux and improve your daily life in the long term. The best vitamins to support silent reflux. Bonus edition. Vitamins and nutrients play an important role in supporting healthy digestion and can help relieve the symptoms of silent reflux. Laryngopharyngeal reflux, LPR. A balanced diet and targeted vitamin intake can help the body reduce inflammation, protect mucous membranes, and improve digestion. Here are the most important vitamins that can help with silent reflux. Vitamin D. Why it helps. Vitamin D is important for overall immune health and promoting digestion. A vitamin D deficiency can impair digestive function and worsen inflammation, which can worsen the symptoms of silent reflux. Sources. Sunlight is the best natural source of vitamin D. Vitamin D-rich foods can also be found in oily fish, for example, salmon, mackerel, eggs, and fortified dairy products. Vitamin D supplements are a good option for people who get little sunlight. Dosage. The daily recommended dose of vitamin D is approximately 800 to 1000 IU. It is advisable to have your vitamin D blood levels tested to determine the correct dose. Vitamin C. In non-acidic form. Why it helps. Vitamin C is a powerful antioxidant that boosts the immune system and has anti-inflammatory properties. It helps protect mucous membranes and promotes healing of tissue damage caused by reflux. Caution. Be sure to use non-acidic forms of vitamin C. For example, calcium ascorbate or sodium ascorbate, as highly acidic forms, such as ascorbic acid, may worsen the symptoms of silent reflux. Sources. Natural sources include berries, broccoli, bell peppers, and spinach. When taking supplements, look for buffered vitamin C products. Dosage. The recommended daily dose is 500 to 1000 milligrams. If you get vitamin C from natural sources, this amount is often sufficient. Vitamin E. Why it helps. Vitamin E is a powerful antioxidant that reduces inflammation and protects mucous membranes. It helps protect cells from damage caused by excess stomach acid and supports the healing of irritated tissue in the throat and esophagus. Sources. Good sources of vitamin E are nuts. For example, almonds, hazelnuts, seeds, avocados, spinach and vegetable oils, such as olive oil. Dosage. A daily dose of 15 mg is recommended. When taking supplements, make sure to choose natural forms of vitamin E. D-alpha tocopherol. Vitamin A. Why it helps. Vitamin A supports the health of the mucous membranes in the digestive tract and may help regenerate the lining of the esophagus and throat. This may promote healing of damage caused by acid reflux. Sources. Vitamin A is abundant in carrots, sweet potatoes, green leafy vegetables and red bell peppers. Caution. Excessive intake of vitamin A from supplements can be toxic. It is safer to obtain vitamin A from natural foods. Dosage. The recommended daily dose for adults is approximately 700-900 mcg. Consult your doctor before taking high-dose supplements. B vitamins. Why they help. The B vitamins, especially vitamin B6 and vitamin B12, play an important role in nerve function and tissue regeneration. Vitamin B12 deficiency can be caused by long-term use of proton pump inhibitors, PPIs, as these inhibit B12 absorption. Sources: vitamin B6 is found in bananas, avocados, poultry, and whole grain products. Vitamin B12 is found primarily in animal products such as eggs, fish, and meat. Dosage: the recommended daily intake for vitamin B6 is approximately 1.3 mg and for vitamin B12 is 2.4 micrograms. A blood test can help determine if supplementation is necessary. Magnesium. Why it helps. While not a vitamin, magnesium is an essential mineral that promotes muscle relaxation in the digestive system. It helps prevent spasms that can occur due to reflux and supports healthy function of the lower esophageal sphincter, LER, which prevents stomach acid from flowing back into the esophagus. Sources: dark leafy vegetables, for example, spinach, almonds, pumpkin seeds, whole grain products and legumes are good sources of magnesium. Dosage: the recommended daily dose is approximately 300-400 mg. Talk to your doctor if you want to take magnesium supplements, especially if you are taking medications such as proton pump inhibitors, PPIs, which can lower magnesium levels. Zinc. Why it helps. Zinc supports tissue healing and has anti-inflammatory properties. It's important for the regeneration of mucous membranes and can help repair irritated areas in the throat and esophagus. Sources: oysters, beef, chickpeas, pumpkin seeds and nuts are rich in zinc. Dosage: the recommended daily dose for adults is 8-11 mg. When taking supplements long term, it is important to avoid overdose. Conclusion: the right vitamins and minerals can help relieve silent reflux and support digestive health. It's important to get vitamins from a balanced diet and only use supplements when needed. Before taking any supplements, it's advisable to consult your doctor or nutritionist to determine the correct dosages and the best preparations for your needs. Rights and ownership notice. This audiobook is published and distributed by Testberichtdienste LLC. All copyrights, publishing rights, distribution rights, audio rights, and related intellectual property rights for this work have been lawfully and exclusively acquired by Testberichtdienste LLC. Testberichtdienste LLC is the sole and unrestricted rights holder of this audiobook, including the right to reproduce, distribute, publish, monetize, and publicly perform the content on digital platforms such as YouTube. The original manuscript files, source documents, and contractual acquisition records serve as proof of lawful ownership. The original author and/or their authorized representative, Renovatio LLC, has transferred all relevant rights to Testberichtdienste LLC in accordance with applicable copyright and publishing law. This ownership applies to all current and future uses of this work, including audio, video, and digital publications. Effective date of rights ownership: the 1st of February 2026. Any unauthorized use, reproduction, re-upload, redistribution, or claiming of this content is strictly prohibited. Copyright Testberichtdienste LLC. All rights reserved.